can we record? I warmly welcome you to this virtual meeting on economic empowerment of women in health, featuring medical women in business. This distinguished audience may wish to be informed that of the 17 people who made donations to support my campaign for the position of MWAN President-elect and MWAN Delta State to mobilize members to the 20th MWAN Biennial Conference and General Assembly at Abuja, Federal Capital Territory in 2017, only 4 were women. The remaining were men. This was a wake-up call that made me choose economic empowerment of women for/in health as a sub-theme for the 2019 to 2021 biennium. I had a vision of an MWAN wherein if we wanted to raise funds for a project, we can get 20 medical women donating 50,000 within the first week. So far, we have not done badly, but we can do more. At the beginning of the biennium, we organized a pre-conference event titled Economic Empowerment of Women for Health in Asaba, which featured presentations on private practice, travel and thought, as well as financial planning. The presentations can be downloaded from our website through a link. In December 2019, at the first NET meeting in Aba, Abia State, a presentation on strategies to economically empower female adults and youths was delivered. The presentation can also be downloaded from the website via this link. During that presentation, MWAN members were encouraged to start from 30 years of age to save about 50,000 a month to achieve 500,000 in 1 year. This money is to be kept for medical or health emergencies. By the age of 32, medical woman would have saved 1 million. By 40 years, 5 million. By 50 years, 10 million. By 60 years, 15 million. And then 20 million by 70 years. Older medical women who have not started saving at all were encouraged to spend less and seek extra ways of generating income to meet their targets for their age by the end of the biennium in September 2021. If no health emergency occurred by 70 years, the funds can be used for an investment or for inheritance by children and grandchildren. This was to avoid a situation where we have to engage in public appeals for treatment of medical doctors. Experience has shown that we do not even get up to 1/4 of the funds required, which I consider a double shame. The first shame is that the medical doctor has to make his or her predicament public. And the second shame is that the body of medical doctors do not have enough to contribute or are unwilling to do so. And I wonder, how can this be when we are among the highest paid government workers? It all boils down to lack of financial planning. Hence, I started the initiative. Reminders on the financial planning initiative have been circulated to MWAN members regularly. Today, we are having a virtual meeting on economic empowerment of women in health by featuring medical women in business. We'll have 3 presentations on private medical practice by Dr. Funke Lawson, Medical Director, Zankli Medical Center, Abuja. Event management by Dr. Chioma Ajato, creative and virtual event consultant for unique rental services. And then product marketing, Oriflame Experience by Dr. Vivian Omoagoja, MWAN National Publicity Secretary / Oriflame Product Consultant. In between presentations, we shall be playing video jingles to create awareness of various products and services, as well as our MWAN programs. This, we hope, will increase patronage and foster more partnership. It is my sincere hope that those present today will be economically empowered for their individual benefit and that of the association after today's event. Thank you for attending, and God bless. I hope everybody heard me.
Yes, yes, ma'am.
Oh, thank God for that. 41, we are doing very well. So we'll go over to Dr.
Thank
Lawson.
you, Madam
She's already
President.
sharing her slide. Yes, you're welcome. Dr. Lawson, please go ahead with your presentation. We're eagerly waiting.
Good morning,
distinguished, esteemed medical women. I'm sharing my screen now. Please let me know if you are hearing me and if you are seeing my screen.
Volume is low, ma.
That's the highest volume I have. You can't hear me clearly. Can you hear me, please?
Yes, ma, we can hear you. We can hear you, ma.
Okay, somebody said the volume was low. So,
if they call, let me know.
screen as well. I'm sharing my screen now. Can you see my screen, please?
Yes, ma, we can see your screen also.
Okay, so good afternoon again. I'm going to talk about private medical practice. It's a privilege to talk to you about this. I don't know why I've been chosen, but I feel humbled. I'm a pediatrician. I'm also the executive chairman of Franklin Medical Center, Abuja. We have a chief medical director, so I don't want to take his place. But I was a medical director several years ago before I stepped aside and we got a chief medical director who is under me, actually. So I'm going to talk today about the regulatory requirements for starting a private hospital, our journey in Zankli, the challenges we face, and conclude and give some information on how to have a successful practice. I hope we're successful. I thank God for where we are. As way of introduction, we know that access to quality medical services is very important to the overall survival of any community at all. There's a symbiosis between health and national development. And we know everywhere in the world, healthcare delivery is expensive. And governments face various constraints that make them prioritize their spending on health. You know, the low percentage that Nigeria allocates to healthcare. And there are challenges facing the public health management. And private medical practice to be able to complement government efforts in providing healthcare to a greater population. Over the years, this has evolved from sole practice. You know, before, most times, anybody who had a practice would always just be the only one doing the practice. But now, we have many people who are doing group medical practice, as it's called. In the developed countries, that is the way to go. For a long time, that's what they have done. But here, we're trying to learn how to, and sole practice itself is becoming extinct in various parts of the world. And specialists now come together in groups to have decent and quality practice. So for you to go into private practice, you have to know that there are regulatory bodies that monitor and enforce discipline in the private sector. The doctor becomes an entrepreneur who organizes a business, manages it, and usually will take initiatives and risks, employ labor. And conventional thinking is that as doctors, we're not equipped to be businessmen because in medical school, we're not taught how to be businessmen. It's out of our school curriculum. And we just learn how to be clinicians and sometimes researchers. And knowing how to build a vigorous and sustainable business model will help us to go. That is private medical practice. Normally, most people on completion of medical education and look for employment in government establishment. Some will go ahead to go into private practice. I must commend my husband. He took a bold leap very early in 1977 to go into private medical practice after he did service. And over the years, I joined him. For me, I always thought I would be in the academics forever. I was a lecturer, a consultant in the city hospital. But when he moved to Abuja, I joined him. Now you have a lot of doctors just roaming the street looking for jobs, and we can have people who will invest in private medical practice. They can employ these doctors also. So not all of us are equipped to be in private medical business. So there are two ways you can look at it. You can be a private medical practitioner, or you can be a private medical businessman. The first one actually is the doctor that sets up a clinic as an entrepreneur and sees it well as a venture. But the other one, that's the private medical business, are those business, they may not be medical doctors, or they may be paramedical, set it up and now equip it and look for doctors to manage it. So, but for those of us here, I guess we would fall into the first group. That's the doctorpreneur, who is a doctor and wants to go into the business of private medical practice. So you have to have an interest, first of all. Initially, I didn't have the interest. I wanted to just be an academician. I wanted to be a professor. But because of my husband's move to Abuja, I had to come with him. I didn't want him to come alone. So I resigned from the university. I joined him. And I initially thought I would continue on the line of academics and join the teaching hospital and all that. That was just being set up in 1997 when we came here. But nothing was happening there yet. I decided I would put my all into the practice. And I was one of the very first pediatricians here in Abuja. And that helped our practice because we called this Zanti Medical Center and teaching at Zanti Medical Center and Children's Hospital. So it attracted a lot of the children, then their parents and other patients. So you must have that interest. And once I joined, I showed the interest, the passion, gave my all. I mean, we worked like, would I say, 20 hours in a day. We were always on call because we were just two of us, my husband and I initially. So you have to know that at the beginning, you are going to have to sacrifice a lot. We left comfort in Jos to come to Abuja to start up something that was way less than whatever we had there. And we were motivated because we saw that there was a future in Abuja. Hard work was important, honesty, and innovation. So from the beginning, we kept saying, what next, what next, what next, not trying to stay in one place. And in terms of funding, when you are in practice, you have self-funding, you have loans, you have inheritance. I think we're going to have that discussed later. We were able to get some self-funding and to sell off some things to do it initially. But what is more important is that let your work speak for you. So I think that is the grace we had here. We were consistent throughout, and everything that came in, we put back into the practice. It wasn't about, okay, there's a game today, let's go. We kept putting back until we grew and grew and grew. And we improve ourselves. And so we added more staff, we veered into other specialties, brought in other specialties. And we didn't have to go around looking for retainership. We never did that at any time. We just let the work speak for us. And we continue to go for courses. My husband later went on to do a PhD. He was interested in research. And in the hospital, we were able to integrate research into practice. And that's something that people don't know can exist together. And that brought even more into the hospital. We surrounded ourselves with motivated staff. And each staff that came in, we always welcome them like, you are welcome into the Zanti family. It is a family. So they always felt part of it, and we kept them abreast of what was going on. We had referrals for those cases that we thought we couldn't manage, and we followed up with those referrals to tertiary centers, collaborations all over in Nigeria, abroad, in various specialties, and we encourage the staff too to do that with other people. So the regulatory requirements, let me go back to that before I come to Zanti again. You have a lot of healthcare facilities all over in Nigeria, over 200 population strength. So you can imagine that our requirements are not even met yet. And we need to have basic facilities for medical investigation, diagnosis, treatment, out and inpatient in all these facilities. Outside the general specifications by the Federal Ministry of Health, we need to also know that there are some states that have designated regulators, and there are some professional bodies that regulate practice. So when you want to set out, you have to first register a business name with CAC. You have to have an operation permit from the Federal Ministry of Health through your own state Ministry of Health. Then you need to have operating license from that state Ministry of Health as well, and in the FCC. They are usually health facility monitoring and accreditation agencies in all these states. The basic infrastructure is a building that must be composite. That is not part of any normal residential accommodation. It must be spacious with some of these basic parts to it. Waiting room, medical records, consulting room, treatment room, toilet, pharmacy or dispensing room, staff or call room, admission of observation. It depends on how big you want it to be, but these are the basics for even the minimum. You must have a studio where you can do teaching, the dressing and all that, and in small lab. The staffing requirements, the major regulatory bodies include MDC for the doctors, nursing council, the medical lab, for the civil society, the medical society, so many of them. There are others too. And now we have so many paramedical regulatory bodies to whom you have to pay some annual subscription for your staff. So you have to prepare that you have to do this for them. And also, you must have your certificate of full registration and evidence of annual practicing license to be able to practice. Then the administrator, I don't know whether this still stands, but at the time, the MDCN required that the medical administrator has to be a consultant, medical or medical officer who has 10 years post registration experience. And any hospital that performs drugs requires a study of required direction. The doctor, 5 years. Well, sorry, the minimum for any doctor you employ, you must have done his recently. That's the minimum. So you can employ doctor if the nurses will be registered and the staffing. Those are the basic staff members that you need. In the environment, you should have a good supply of water, proper waste management system, because in Abuja, the Abuja Environmental Development Agency has waste management system for hospitals because of the risk. We have to pay to them. It's a lot of money, so you should be prepared for that. You have hospital safety devices, the sharp, the different things, dedicated supporting. So you cannot be throughout. So you have to pray. One of good relationship with the patients, with their colleagues, and creating an enabling environment. When they do well, we give them bonuses. When we do well at certain times, we increase their remuneration. And for us, we try to keep at least one doctor in all the specialties within the hospital. And professional competence is very important. The appropriate medical equipment are listed here, but it depends on the level of healthcare that you want to provide. So there are some basic things that will be given from the authorizing agency. So our story, we started in Jos in 1990. Zanki was started in Jos in 1990. So you can see the picture. I just took a picture of it. I signed it. It's not too clear. That was in Jos in 1990. In 1997, my husband visited Abuja and decided that we should move because he thought there was a future there. And like I told him then, I said, when the snail moves, the crown follows. And that's what I did. I have no regrets. And I tried to do even my academic and research interest, even though I'm in private practice. On the right, you can see the building that we converted when we got to Abuja to a hospital. That was the building. We were living there. We took one room where I stayed with him and our 3 sons. And it shouldn't have been the case because we are not supposed to live where the hospital is. But we were starting off, so we took a place there. We managed it for a few months before we moved out, and we rented the place. After that, we were able to sell off our property exactly in Abuja, in Jos, to build. And that's the building we had up initially. Initially, it was just the carcass. This actually was later on because we started with one building and added another and another. So this would have been like in 2005. Now it's what we have now is that because we keep investing, it has paid off. It's a secondary care medical group practice, and we make every doctor feel that he's a part of it. We have 34 full-time doctors and several visiting doctors that come and go. They have their consulting time. I mean, almost every subspecialty, we have them. We have beds for admission, and our staff strength is about 200. Every week, we get an average of 900 patients with outpatients. So in our practice, we regularly have CMEs and talk about good medical practice as well. And the provision of good medical practice cannot be overemphasized. And we talk about the patient's observance of professional ethical education. So those are the codes, the rules, the standards, the guidelines, compliance. The challenges, well, in a way, private sector is relatively unregulated because there are many unqualified people who find ready employment in various places that become hospitals or private hospitals. And that gives a bad name to private medical practice because many people who go in go to make money. Not even have an idea about science or biology working in the theater. They don't know how to protect themselves. They don't even know the implements of keeping themselves safe. We have some people who employ so-called lab technicians that don't know what to do. So all those are there, and people sometimes will come to you and say they know what more than what you know. So you have the issue of how much they can do. So it's after employing them that you realize that. Thank you. You have to always make sure you check the credentials of people that you employ and train everyone on how to keep themselves safe and to keep your clients safe. Of course, good customer service, because from the door, the first person that the client sees is the medical records officer, and they are the ones that will make the first impression. So we keep talking about good customer care. And that is something that is a problem in Nigeria because people think they're just coming to work, but they don't, and at the end of the month, they get their salary. So we have to keep telling them the patient is always right. There's a big gold sign. So don't shout at them, don't make them feel unwelcome, just keep your cool. But it's a lot of challenge. I think that's a major challenge, customer care. Then the second, of course, is funding. For most people, getting the startup fund. I hope we've gained from previous talks about funding in healthcare. But there are many that are available now. And BOI especially gives good rates for equipment. We're able to buy a CT scan from BOI, and the interest rate was very low, over 5 years. There's also the problem of multiple taxation. You'll be taxed at the federal level, at the state level, those of us in Abuja, then there's taxation from hospital regulators, they come and count the number of beds, then you have another one, so many. And it's an issue that the Guild of Medical Directors and the Association of General Medical Practice have been following up. And one who decides to go into private practice should be a member of these organizations. And sometimes your staff are unappreciative of your vision and mission. So they just say, oh, but they are making this money. Where is it going? But yours is to put it back and develop. Always be a step ahead of the others. It's not a competition, but you should know that you want to continue to go higher, not to be static at every level. Right now, we're trying to put up a molecular lab, and it's almost at the completion stage because we have that vision that we always want to provide the best. You look at what is happening in the environment and you key into that and also try and make the best for your establishment. Of course, there's the issue of fraud. We've had a lot of people stealing and being fraudulent, and those who we've had to lay off quite a number of staff for this. But the electronic health system has helped a lot. So when you are going to medical practice, you have to keep in mind that you must have the HR in place, because that's the only way you'll be able to at least streamline all these stealing. Issue of litigation will always come up. There's no way. You can't say you are the best. There are people who will be annoyed. There's somebody who took us to court because he said they told him to hold his child after delivery. Because he was told to hold his child while somebody was changing the bed or something.
Yeah, that's the figure. Yes,
things that they take support for, but just make sure you are in the right. You are doing the right, giving the best. And of course, social media doesn't help. One news, they just blow it up into something more than what it is, and a lot of it are fake news. And then generalization of comments about private hospitals. When somebody says, oh, it's from a private hospital, he went to private hospital before they refer to here. It's not all private hospitals are like that, and you should make sure that yours is not talked about like that, like, oh, one of those private hospitals. You know what you want to give the patient. So in conclusion, I want to say that starting a hospital, like any other business, requires a lot of planning, especially because of the sensitive nature of this hospital business. But the starting point is to be familiar with the regulatory requirements before you go into it and comply with those requirements. Patients are entitled to good standards of medical care, and you must have good relationships with your patients and with your colleagues. Don't lord it over them because you are the medical director or the head of the hospital. Observance of professional ethical obligations is key, and you should keep reminding those who work with you about that. And secure managed care contracts are essential. You have contracts with HMOs and all these other organizations. Physicians that are new in private practice, I encourage them to go into this practice because it really pays off. And we cannot emphasize continuing professional development. Like our MWAN national president shared the 7 habits of highly effective people. This comes into play even in our private practice. I went for a course in leadership some time back, and it has really helped me because everything I do, I look at these 7 habits. Am I being proactive about it? I have an end in mind. Am I working towards that goal? I put things first. Prioritize, put them in compartments. Okay, what is important? To change those first before you start thinking about other things. And it's a win-win situation. Don't think the other person working for you has to lose for you to gain. It can always be a win-win situation. First, take to understand. Understand those who work with you. Understand those.
And it also went to the market for us. She may tell me to come and collect them.
Strategize and sharpen the sword. That's keep reinventing yourself and make time to rest. I've written some links on guidelines here, and I hope they're helpful. Thank you very much for listening. God bless you.
Thank you very, very much, Dr. Lawson, for such an inspiring. Who is muting me now? I'm the moderator. Because of our time, we will have to ask anybody who has questions to put it on the chat. And I'm going to save those questions so that I'll make sure that all of them are answered, if not during this period, subsequently, or via email. So I want to thank you very, very much for that beautiful presentation. I want to especially recognize Honorable Dr. Sununu, who is here with us. We are very honored to have him. He is the Chairman, House Committee on Health in the House of Representatives. Sir, you're very welcome. Thank you for joining us. I think you're a bit early. This one is actually the program, a prelude to the one we actually invited you for. The one we invited you for is 12 o'clock, but we are still happy to have you, sir. Thank you, sir. So we are going to the next presentation, and that is on event management by Dr. Chioma Ajato. Dr. Chioma Ajato, you can share your slide, and you have 15 minutes.
Okay, thank you, Madam N, for this opportunity. Thank you, members of MWAN, this presentation. I come to my little wealth of experience with event planning and management. By way of introduction, like I said, I'm Dr. Jaffa Choma, virtual for Unique Rental Services. Unique Rental Services is actually an event management company owned by my husband, because it was registered over 20 years ago. And then by virtue of marriage and my experience, I was opted into the company about 9 years ago to assist with, to serve in this capacity. So to go on, we're going to be discussing event management with the following outline: definition of terms, process of event management, down to steps to start an event management system. You must note that an event is any public assembly for the purpose of celebration, education, marketing, reunion. There are so many reasons, but we should also note that there are temporary occurrences, either planned or planned, but they must have a finite length of time. No event on forever.
Please, Dr. Chioma, can you click on slideshow so that it's a bit bigger, the presentation? Yeah. Thank you.
Okay. So for all events have this features. All events are unique. No two events are the same. They are intangible. You can't hold them in your hands, but you know that something has happened. And then the ambience and service you experience at each event is different from the other ones. Events are usually labor intensive. For each event you go to, be a naming ceremony, a cultural event, a burial, an educational event, it takes a village of people to put this together. So it's actually a labor intensive process. It's
President-elect Nanya, Adekemi Okelani.
for a burial or an educational event or a promotional event. You have now, with respect to COVID and what we are going through, when the client comes to you, you should actually try to figure out what amount of personal contact will be needed for the event. So different events have required amount of personal contact, minimum personal contact and interaction required. Some events could just be maybe a lecturer giving a didactic lecture to a group of people. So in that way, you don't need so much interaction. Whereas if you were a birthday party, there might need to be a lot of personal interaction, you know. So these things matter. Then there is a fixed time scale. What do I mean by that? For birthdays, for weddings, you know, there is a time, an appropriate time for each event. So those are the features of events. Now, what are the scope or types of events? We have commercial events, we have marketing and promotional events, we have festivals, fundraising, sports, educational or religious events. The list is not exhaustive, but these are the common types of events that we have. And then what what's the purpose of organizing events? Because most people think 10 years, 15 years ago, it wasn't common to have an event plan as per se. Everybody could go to the market and plan their events with their phones, even right now. But if you are a brand, the best way to build your brand, to showcase your brand to your target and what we are having now is an event, and I'm sure there is a marketing plan behind this event we are having. And so, doing the event offer an opportunity for certain products that we have to be showcased to the people. Then, what is event management? It's the process of organizing a professional and focused event with a particular target audience. Now it involves visualizing concepts, planning, budgeting, and executing of the events such as fashion shows, concerts, seminars, exhibitions, wedding celebrations, theme parties, product launch. But the most important thing is you must plan, you must budget, you must implement, and you must come back to evaluate if you have achieved your set goals and objectives at the end of the event. Now, what's the process of event management? These are things that we do by virtue of maybe having organized one or two events in the past. But it's better to see it this way. The first thing is to select what kind of event you want to do. Is it a commercial event? Is it a marketing event? Is it an educational event? For instance, this event we're having is an educational event. Now we decide the venue. Is it going to be physical? Is it going to be virtual? Is it going to be a hybrid event, which is it could be physical and virtual at the same time? Then the particular, if it's physical, where's the particular physical location? Do you want it to be in a hotel? Do you want it to be in somebody's house? What's the weather like? And the weather would affect your choice of deciding the venue. What kind of, if it's a children's party, for instance, you have to look at safety considerations in deciding the venue. You also have to look at the budget you have. For instance, if you are having, I'll keep going back to an event I planned in November. Let me just use that. It was supposed to be, it was a hybrid event. National Thoracic Society it had two venues. It was being hosted by Navy and Asaba. But due to COVID restrictions, we had to find a way now to make the event hybrid, both physical and virtual. We also had to look at budget venue would be, because you don't have the budget, maybe a total budget of, let's say, 1 million, and then you go to choose a venue that is much more expensive than what you have for your budget. Then the thought process you work with your money. What finances do you have? When your client is coming to you, do they have everything? For instance, if you're going to do audio visual, does your client have the camera, and the camera, the video? If you want to give out educational materials, does your client have the educational materials, or are you going to have to develop all these things? So if you're going to develop it, then that means you have to include that. You have to go into budgeting, talking of how to fundraise, how to do all these things. Then when you have, then the time, what time do you have? At what point in time do they come to meet you to plan the event? For instance, the conference I planned in November was met, I think, in August. Now you have to manage the time, draw a Gantt chart. From what point to one point should things have been achieved? What is the deadline for submissions of policies and maybe congratulatory messages and stuff like that? Now, the next thing is delegation. The fact that you're an event manager doesn't mean that you have to do everything by yourself. You have to assemble a team and then start. You have social media. So one of the first places to actually advertise is you go to, well, depends on where, first of all, depends on where your target audience is. You have to think of, oh, my target audience, are they more on Instagram? Because if you are doing, I've noticed, if I organize a program for doctors, I realize a lot of doctors are not on Instagram. Doctors, am I going to meet them more on their WhatsApp group? Maybe their different WhatsApp groups. So that means I have to keep sending messages, find a way to get these messages directly to them, so that amongst the mix of so many information on WhatsApp, whoever you want to attend the event actually sees it and considers it. Important, something that you can also go a step further if you have newspapers, television to do your jingle, depending on the type of event. If it's educational, of course, if it's a birthday, you might not need to go down. Event marketing
I think we've lost her.
Can you hear me? Sorry, you lost me on my... I'm coming back.
Okay, the one you're using is better. Yes, it's much clearer.
Yes, ma'am. I need to get this across. Okay.
So, no. Okay, so can you hear me, ma'am?
Yes, we can hear you.
Okay. So sorry about the break in transition. Now, office management, it's more or less like even for every event, there must be correspondence. Now you have to decide who is going to receive the correspondence and how are you going to receive the correspondence? Is it via, thank God for now we have email, we have yeah. So you must delegate someone to receive every correspondence pertaining to that event. Because if you're trying to market your event and people are registering, we definitely have registration or further inquiries from prospective sponsors. So you must delegate who would handle your secretariat, that's office management. Then you must have rehearsals. If you fail to plan, you plan to fail. So having done all this and you just keep rehearsals and get to the event day, definitely a lot of things are going to go wrong. You must rehearse to understand if there are to troubleshoot or are there issues that will come up, and how, if the issues come up, look for other ways to sort out the issues before the event day. That is not to say that when you have rehearsed that there are not, that certain things might not come up on the event day, but with rehearsal, when you find those issues occurring on the event day, you are well equipped to handle and to respond to those issues.
We are not seeing your presentation. Is it not possible for you to upload your slide? We can't see the presentation.
Okay, let me share now.
Okay, but if you're almost done, you can just rush through because we are
Okay.
running out of
Okay,
time.
I'm trying it now. Basically, the importance of event management, we have talked about that. But the most important thing is it saves finances, it saves time, and it saves stress for the client, who came to you. Then, people involved as the client who pays you for the job, you yourself who is the event manager, then the technical staff. You can't do without technical staff because, like I said, you cannot handle everything. You cannot be the cook, you can't be the videographer, you can't be the audio person. So you have a village, you should have a strong team of people working behind you to ensure that your clients' dreams are turned into reality. Okay. Now, there are certain policies and procedures you must establish for every event. You must talk about who handles the finances, cash handling, who is going to pay the film policy, that's the video policy, who is handling the video, when is it going to come back, is it getting food policy, fundraising policy, sound policy, public safety is very important, especially now that we're talking about COVID-19 and we're talking about infection prevention and control. You must have sound public safety policies for every event that you handle. Then transportation, vendor management, at the point of the event. Now, competencies for event management. You need to have communication skills. You must be okay. Yeah, you must be able to multitask. You must be able to think on your feet. Be able to have regardless of being under pressure, your customer should always come first. You must team, like I said before. You must be able to facilitate people, make sure that they cooperate. And you must have good networking skills because you're working with different people, with different characters, with different viewpoints. You must be able to bring them to a central place, to a point where they see that the success of the event is much more paramount than their personal, their personal feelings. Then you must be flexible. Several times I've come to an initial meeting with clients, and then clients could go out on the first meeting and decide that, oh, something is trending, I need to put it in, or you tell them, please, can you meet up with this deadline? And they can't meet up. Don't get angry because they're human beings. You just have to be flexible, ensuring that you are patient with them till they get what they want. Of course, within a reasonable and a considerable time frame. Nobody should overstretch you beyond what they have paid for. Now, post-event activities. Events do not just end on that day. You should conduct polls, appreciation messages. After people come for an event, you should be able to, as event planner, either remind the person who did the event to send thank you messages, or you help the person to do that. You must publish a recap or a summary of what that event is all about. At least send it to the person who contracted you for the event. Then you must evaluate. Of course, evaluation could be done along the line of planning or even at the end, but make sure that you have had tangible objectives at the beginning of the event, knowing what yardstick are we going to use to measure and say this event is successful? Are we going to say, oh, everybody ate and they were happy? Not just eating. At what time did they eat? Did everybody who registered for this conference, did they go back to their conference materials? Was there smooth audio visuals at the event? You measure the performance. Somebody once said anyway that there is hardly any event that will be perfect or true. So as an event manager, you need to have an open heart, be open to corrections, because while you're measuring the performance, you might see some areas of lapses. Just brush it off, correct those deviations, and ensure that it doesn't occur at the next event. Now, remuneration for event managers. It could be fixed or commission-based. And then it's dependent on the location, type of event, the duration of events, your client brief, what does your client want, your extent of involvement. number of technical staff required, and reputation of the event company. For instance, doing a two-day hybrid event for 200 people requiring at least 3 months of planning and full event. When I mean hybrid, both online and physical. The fixed minimum rate should be at least 200,000, provided that all other expenses are paid for by the client. What the fixed rate is, because remember that it's a full-time job. You're going to be sitting down there for, if the event is for 8 hours, you are not expected to disappear from the venue at any point in time. So it's more or less like you are at that venue for, your full attention is required for 8 hours. And it doesn't just stop. Remember that there are rehearsals that you should have attended. There are a lot of communications that you should have done way before. So it's not just a 2-day thing. It goes way back. So at least if you're paid 200,000 per day, for these 2 days, then you will not be so tired and you will not be at a loss. Now, I think this is almost the last slide. Steps to starting an event management business. You must have your niche. One mistake people make is to be involved in everything. You must decide what kind of events that you will not do. Let's start from there. When you know the kind of events you will not do, then you focus on the ones that you have a passion for. I know people that have a passion just for children's birthdays, and they say it's only children's birthdays that they're going to do, Then you can, when also, I'm not going to work for less than this amount or do events that are less than this amount, because there are events that are quite cheap, but the amount of energy that you would put in, you would even regret. So sometimes, I'll use my husband, for example, because when he drew his business to a stage, he said he will not collect less than, he will not get, not that he won't collect, but he will not get involved in jobs that are less than a particular amount. And so when such jobs come,
Hello? 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 It might not be formal, but you must always seek to improve your knowledge. Then establish partnerships, because your referrals will come from partnerships that you have. And then remember, like I said, it takes a village. So you must have
contact. So you must establish partnership. I don't know of any event planner that is an island, and you must have contacts within the event planning sphere and then outside the event planning sphere. Then register your business with CAC, because if you don't have a business name, anybody could come along after all your years of hard work, come along and collect your name. And then, remember I said price fixing is based on how well known your company is. And takes up that name, it's more or less like what's the word? Identity, stolen identity, basically. So you have to register your name so that all your work is not lost. And then you advertise on social media, advertise. Don't forget word of mouth. Don't forget word of mouth, because once you do a good job, people would always refer you. And so, in fact, your first job is your primary means of advertising, because everybody who comes for an event, once your flyers and your stickers are there, they would, once you've done a good job, they will be encouraged to call you for another one. So, challenges of event management: time, shrinking budget. You could start an event with a very beautiful budget time. Then innovation and creativity. You don't want to keep reinventing the wheel. You could have audiovisual equipment failure. What do you do when it happens? Then social media is so, and fads and trends, they are so fickle. You could actually be planning an event, especially if it's an event you've been planning for a long time, and then the trend changes. So you need to be able to forecast, sit in January and say, oh, what is going to be trending in December? If you have a client who calls you very early for an event, because if you are planning with what's involved, before you get to December, that's a very huge problem in Nigeria, especially with respect to infection prevention control. But we are getting there. You need to employ adequate personnel and train them. Let them know that you're strict and you're known for that your policies should not be messed with, basically. So inspirational quote for event planners. Basically, when you
We cannot get the last slide, so we will have to wrap it up here. There are a couple of questions that have been sent to Dr. Ajato on the chat. So please, we'll be grateful if you will, if you can send chat responses for now, since we've run out of time for our first event. So we are going quickly to the second segment on monitoring health programs. And I have just I've just posted the agenda, the program on the chat so that we can be guided. I don't know what happened to the time. We were expecting that we will even have time for questions and answers in between, but somehow, before we knew it, we've already reached 12 o'clock. So let us just move on to the second segment, because we have visitors who are supposed to give us goodwill messages. So without much ado, I want to welcome everyone by giving opening remarks for the second segment, and that I'm going to do shortly. So I have some brief opening remarks on this occasion of the virtual meeting on monitoring and evaluation of health programs. Today, Saturday, 9th January 2021. Esteemed colleagues, distinguished ladies and gentlemen, I want to warmly welcome you to this event, which marks the first program organized by Medical Women's Association of Nigeria for the year 2021. Since the beginning of the 2019 to 2021 biennium, MWAN has organized several educational programs as well as health projects. After so many programs and projects, the MWAN National Secretariat is engaging in evaluating the impact of the programs and projects. Today, we shall be discussing monitoring and evaluation of health programs, looking at programs initiated by MWAN in this biennium and other programs. We want to especially appreciate our guest, Dr. Ngozi Azodo, one of us. She's the Director of Health Planning and Health Research and Planning in the Federal Ministry of Health. She will be giving us a goodwill message. I also want to welcome Dr. Stanley Okpai. He is the program manager of the Park for Sale project of the DRPC in Abuja. They have been supporting MWAN in several ways, and the funding that we've received from them, we have been able to use to support our adopted health facilities program. So he'll be giving us a goodwill message. We also want to welcome Honorable Dr. Sununu, House Committee Chair on Health for the House of Representatives in Federal Capital Territory, Abuja. It is my sincere hope that MWAN members and other participants here present will be able to do much more to promote the health of our women and children after today's event. Thank you for attending our event, and God bless. So please be patient. The third presentation on economic empowerment of women in health will be given at the end of this program. So don't go away. On this note, I would like to call on, we're going to call on Dr. Azodo to give her goodwill message. Please, can we unmute her if you can find her from the participants? Make sure, can you raise your hand so that we can find you and unmute you quickly? Yes.
Okay.
Oh, there she is. All right. It's good to see you.
Thank you, Madam Chair, and Happy New Year, MWAN, and all our distinguished guests. Let me say that I'm very honored, to be part of this event. And I also want to especially appreciate our national president, Dr. Mini Oseji, who has given us incredible leadership in the last 1 year. We really just must say that MWAN is, experiencing, a revolution, and one is happy to be part of this process. I also want to thank those who have spoken before now, on the capacity empowerment segment of this program. Now, my role is simple, and it is to say Happy New Year, everyone, and to give a goodwill message on my behalf. But because I spoke to the Minister of Health about this program, I also want to say the Minister has conveyed his goodwill to us at MWAN, and also is willing and available to partner with us. And that's
Thank you. Thank you.
I mentioned to him about the activities that have gone on with MWAN, and he's quite happy. And now that we're looking at COVID and the issues of mobilizing stakeholders around the vaccine, I think that's a critical area that MWAN can be involved in. And so we can take that to the bank and hold the minister accountable on that.
Noted. Noted.
So now back to M&E. Yes, back to M&E. The National Health Act, of course, at Section 35, gave the Federal Ministry of Health, all of us, the responsibility to facilitate, coordinate, and establish, implement, and maintain health information system at all levels in order to create a comprehensive national health management information system. And in Section 38, the private sector, private care providers, and MWAN stakeholders, other stakeholders, NGOs, CBOs are also required to be part of this process. So what we're doing today is good, is critical, and is backed by the law. So please, let's also take note of that. So M&E, what are we doing as M&E? We want to assess performance of whatever we are doing, and from what our national president has said, we're assessing the performance, and then of course the usefulness or the relevance of what we have done in the last 1 year. So we are doing the right thing, and we are required to, for us to be able to do that, we need a lot of data, a lot of information. And as part of efforts to continue to improve health status of Nigerians, we are charged, and when I say we, I mean one, Federal Ministry of Health and all stakeholders, to provide availability of comprehensive health information. And we do have that. We have a DHIS2 platform and health management information system at the Federal Ministry of Health in order to provide us evidence-based planning opportunities and then decision-making using appropriate technology. And more MWAN can key into that. So because this is a goodwill message and because of our time, I'm just going to say that there are a lot of efforts that are ongoing within the ministry, and I expect that the MWAN can key into that. Because of my work in the ministry, we can take our relationship with MWAN a little further. So we have rolled out a lot of opportunities for routine data collection. The tools have been there, they have been revised, and we have developed master facility lists and rollout of National Health Facility Registry in the country. There's also the health information exchange guidelines that have all been rolled out. So I'm going to make this brief by asking, what can MWAN do? How can we collaborate? How can the MWAN not just monitor her own activities, but also help to monitor government activities? First, we must engage with the Federal Ministry of Health. So I'm asking you now officially as a staff of the ministry that we can engage the Ministry of Health by writing a simple letter and saying we would like to partner with you in these areas. Then we go through a process of documenting the role MWAN wants to play, and then begin to see how we can engage with MWAN officially. So we can, look at the issues around basic healthcare provision fund. Those are critical issues that are on the table now. The issues around vaccine uptake, those are issues where MWAN can play a role. And then, of course, integration of within the work of other critical stakeholders, like the National Assembly, NGOs, CBOs, and of course the sub sectors of the health sector like FPA, CDA, NHIS, and all of that. So what I'm saying in effect is that this is a great opportunity for us to engage with the Federal Ministry of Health. There are a number of opportunities that are ongoing, that are being rolled out, and MWAN is not only qualified, not only well situated, but overqualified, to engage with the health sector. And so I want to ask formally that we take those steps. I want to thank MWAN for creating this opportunity, and also asking that in the next quarterly M&E meeting of the technical working group of the ministry, MWAN will be invited to play a role.
Thank you. Thank you very much.
Thank you for your leadership, your incredible leadership. We are very proud of you. Good morning, everyone.
Thank you. Thank you, ma'am, for your very kind words. And I would like to respond briefly by saying part of those leadership qualities were imbibed from you, because I remember when I was a very young director in the Delta State Ministry of Health, I used to come to you with a lot of problems. I would send letters all the way from Delta. You helped me send it to partners. So you contributed to those leadership qualities. Thank you very much. Your request for the letter to the Federal Ministry of Health is welcome indeed, and we will get to it on the first working day of the week, of the coming week. So thank you, ma'am. Other details about the questions you asked, when we give the presentation, you will get more about how we are monitoring both projects of MWAN as well as projects of the projects of the country in general. So thank you very much. So at this juncture, we are going to call on Dr. Stanley Upai from DRPC, and he is going to give another goodwill message. DRPC, they are partners and funders of MWAN, and it started during Dr. Baba's tenure. Thank you. Please, can you raise your hand so that they can unmute you? Dr. Stanley, are you there? Dr. Stanley?
I don't think he's here, ma.
I think he is.
I can't find his name on the participant list.
Okay. All right. So you can put up the slide and then let us start with the presentation. I will
Dr.
start.
Tsuno is here, though.
You're trying to reconnect?
Yes, my Wi-Fi just went off.
Okay, so once you are in, raise your hand so that we will unmute you and you give your goodwill message, please.
Okay, yes.
All right.
Yes.
So he was in, but he went out.
Okay, ma'am.
Yes, so please let us have the presentation quickly. Thank you. Slideshow. Slideshow. Please let it be on slideshow. Good afternoon, everyone, once again. Three of us are going to be making this presentation, and we'll take it turn by turn. And first of all, I will just present the outline. And that involves an introduction. We'll talk about the Worthy Project on Breast Self-Examination, the MWAN Adopted Health Facilities Pilot Demonstration Project to promote maternal, newborn, and child health, the Worthy Project on cervical screening, monitoring and evaluating health programs, and then the conclusion. So I am giving the introduction. Dr. Okwe will give the Worthy Project on breast self-examination. Dr. Agonle is going to give the presentation on M1 adopted health facilities. Then Dr. Okwe will come back and give the Worthy Project on cervical screening. And then I will wrap up with an overview of monitoring and evaluating health programs. Next slide, please. By way of introduction, may I start like this? A younger colleague of mine recently asked me, why are the health indices of African nations so poor? And I will give you two major reasons for the poor indices of African nations. One is corruption, and the second one is poor monitoring and evaluation. The discussion on corruption will leave for another day. The focus today is on improving the monitoring and evaluation of health programs. And just like Dr. Azodo said in her goodwill message, monitoring and evaluation is an approach that has mainly been developed to measure and assess the success and performance of projects, programs, or entire organizations. So by the time we look at our projects, we look at our programs, we'll be able to say whether our organization, which is the Medical Women's Association of Nigeria, is doing well. Next slide. So I will introduce Dr. Uche Okwe. She is the coordinator of the Worthy Project on breast self-examination as well as cervical screening, and she is the National Assistant Secretary of M1. Dr. Uche Okwe, please, can you continue the presentation from here? Thank you.
Am I expected to use this slide to continue with this slide or screen share?
Yes, you are going to use this slide, please.
Okay, please,
Everything
next slide.
slide.
Okay,
This is the slide. No, go
all
to
right.
the first slide. Go to the previous slide. Yes, start with this one.
I can't see.
Use the one I sent to you via WhatsApp.
Okay. It's no longer on the screen here, but I am
seeing it. I'm seeing it very well. So you must have a technical problem. So the backup is to use your WhatsApp.
All right, I'll do that now. All right. The Worthy Project on, can you hear me?
Yes, very
well.
We are hearing you.
The Worthy Project on breast self-examination started this way in commemoration of the 2019 Breast Cancer Awareness Month. The National Secretariat of the Medical Women's Association Nigeria launched the Women's Right to Health Information, which is the Worthy Project on breast self-examination for early detection of breast cancer in October 2019. The Worthy initiative was introduced in 2005 by the 2005 to 2007 National President of M1, Dr. Eleanor Wadinobi, who is currently the President of the Medical Women's International Association. Please, next slide. The Worthy Project on the breast self-examinations duration was from October 2019 to September 2020, totaling about 12 months. Participating states visited health facilities over a period ranging from 1 month to 11 months. These states are Cross River, Delta State, Enugu, Kogi, Ondo, Kaduna, Bayelsa, Ogun State, Kebbi, Oyo, Rivers State, Benue State, Kwara, Edo, Anambra, Zamfara. 16 states in all participated. The states supported by National Secretariat with flyers on breast self-examination were Delta, Kogi, Kebbi, Ondo, Kaduna, and Ogun State. The total number of health facilities in which this project was implemented was 21. The number of persons reached are as follows. The females were 5,372. The males were 241. The females and males were 1,176. And the total persons reached in health facilities was 6,789. Next slide. The number of persons reached outside the health facilities were 5,289. The grand total of persons reached in calculation was 12,078. A total of 3,522 BSc flyers were distributed. 927 cases of breast lumps were seen in the 21 health facilities, and 347 cases of breast cancer diagnosed, and there were only 13 phone calls that were received. After evaluating the performance of the states, M1 Kaduna State was found to be the best performing sponsored state, while M1 Kwara State was the best among the states that were not sponsored by the National Secretariat. So our hearty congratulations go to M1 Kaduna and Kwara State. Hello, can anybody hear me?
We are hearing you. Next slide.
Okay, so the next slide is actually the plaques on the facilities, as the adopted health facility.
And so Dr. Agbonle will take over and present that. So Dr. Agbonle, can you take over? Right. Thank you. Dr. Agbonle, are you unmuted?
Hello, I'm here.
Please go ahead.
Yes. Okay. Good afternoon, everyone. Thank you for the opportunity to present what we have been doing over the last 1 year and some months. The adopted, no, please go forward. This is this slide is unworthy. Good.
It's
the adopted
M1
adopted. Yes, now. Yes. The adopted health facilities pilot demonstration project started in 2019 when we started the biennium. And states were asked to select facilities that they would have wanted to be adopted in their various states. We gave letters and a plaque to each intending state. But we found out that out of the states the 10 states that collected plaques at the Abia neck, which was our first leg, only by March 2020, only 5 of those states had started. And in May 2020, it increased to 7. And by July 2020, we had 8 states. And the participating states were Kaduna, Delta, Oyo, Kwara, Cross Rivers, Benue, Niger, and Zamfara. Next slide, please. This is what our plaque looks like. That's the plaque on the one on your right. And this is M1 Benue presenting their plaque to the CMD of FMC Makurdi. Next slide, please. Next slide. This is also, okay, all those slides show the different states that had done their unveiling. We call it unveiling of the plaque because they must meet the CMD, they must get approval before they put the plaque up and unveil. So these 8 states have done that. Next slide, please. If we look at an overview of the program, also since the last 8 states that have done the adopted facilities, we also have a few others that joined since September 2020. They include Akwa Ibom, Sokoto, Rivers, Imo, and Lagos. Kano and Gombe have proposed, but they haven't completed their unveiling. Next slide, please. Next slide. This is another set of pictures showing showing M1 Zamfara and M1 Lagos during the unveiling. Next slide. Now, in the adopted health facilities are expected, what we go to do there, these are the 4 things we're expected to do. Training and health information, training of the staff of the adopted health facilities, awareness creation on prevailing health programs, provision of medical equipment and drugs, supportive supervision. Please, we need to note that their facilities could be any one of the choice of the state's M1 chapter. It could be a primary healthcare center, it could be federal medical health center, it could be anything that they choose, but they must be sure that they're able to go to that facility and adopt it as we have planned. If we see in the last, please go back to the previous slide. Sorry, come forward, come forward. Yes, the picture here we're seeing on our right, on our left is M1 Kaduna unveiling their adopted health facility. And then on the right is some of the flyers that we have sent to these adopted health facilities. Next slide, please. This is also the unveiling at Delta State and Kwara State. Next slide, please. Now, this is a summary of our reports. If we look through, I don't know if you can see very clearly, but if we look through, we'll see the various data collated for Kwara, Delta, Oyo, Kaduna, Cross Rivers, Benue, Niger, and Zamfara. And we looked at them and found out that Zamfara State had a very high number of maternal and neonatal tetanus, as well as maternal and neonatal deaths. We also noted that Delta had a low family planning uptake in the facility that was being used. Next slide, please. Next slide. Okay, this is not too clear.
No, that one is for River State. They submitted theirs. Yes.
Yes, very late, but we'll just go through it. They also have their facility. You could see it's a small facility, and the data is also written there. They're also very small, but you found out that in the month of April, they had 0 coverage for TD, and I'm very sure that was due to the COVID-19 that started then. So that affected a lot of, that affected the data in the month of April. Next slide, please. Now, from the first table, you notice that Kwara State had a high number of sensitizations, which when we found out that it's basically for individuals and not for programs. So it looks high, but it's not really high. And then the keys, MT is maternal tetanus, MT neonatal tetanus, MD maternal deaths, ND neonatal deaths. Next slide, please. Yes, like I said before, the number of cases of neonatal tetanus and maternal deaths and neonatal deaths in Zamfara State was rather high. And then we noticed that it is better also for us to have an in-depth analysis of tetanus from TD1 to TD5 to give us a better understanding of what's happening in each adopted facility. Next slide, please. Next slide. The IAC materials that we have distributed so far are family planning and its benefits, don't circumcise female children, how to be free of HIV/AIDS, about HIV/AIDS, NURI 2, getting it together books. The NURI 2, they are involved in family planning. They are more in fact, in many states now we have the NURI 2, and they have a lot of information through their books and pamphlets on family planning. So we use that and circulate it to these adopted health facilities. We also have facts about tetanus, male involvement in maternal and child health, gestational diabetes mellitus, postpartum cardiomyopathy, bagging waste, and management of medical waste. Next slide, please.
So back to Dr. Okwe.
That's all.
Thank you so much. Yeah.
Yes, ma'am.
Dr. Okwe, continue from there.
Thank you, Madam National President. Thank you all. Well, with the success of the BSc, MWAN launched a very ambitious project on the women's right to health information worthy of cervical screening for the early detection of cancer of the cervix as part of its activities to commemorate the Cancer Awareness Month in October 2020. This was actually done with the support from Dr. Mrs. Amina Bello and Dr. Ms. Zainab Bakudu, the First Ladies of Niger and Kebbi States, respectively. Our target is the screening of 6,000 women across the nation over the next 6 months and treatment of those that have been diagnosed with cervical cancer. Next slide. Next slide, please. The Worthy Project on cervical screening, we looked at the advocacy issues. MWAN advocates that screening for cancer should not be opportunistic, but mandatory. And
We cannot hear you. Your network. Okay, let me continue from them. Whenever she joins us, we'll give her the screen.
As well as affordable to women who need the service. Family planning programs can be trained in cervical screening, as many of them are already familiar with.
Okay.
Sorry, I'm back.
All right, carry on.
Okay, the
vaccination against
okay,
HPV.
that's many of them are already familiar with it. Yes, but let me start with the item 2. The health personnel, particularly the family planning service providers, should be trained. Cancer screening centers equipped and made accessible as well as affordable to women who need the service. The LGA reproductive supervisors who implement family planning programs can be trained in cervical screening, as many of them are already familiar with the procedure of speculum insertion for intrauterine contraceptive device. Family planning and cancer control can be integrated to maximize. I'm still on the previous slide. Still on the previous slide. Hello?
To maximize human, material, and financial resources.
Can
They
you
brought
hear
it
me?
back. We can hear you. Carry on. The network is so horrible today. Can you hear me? Does anybody hear me? So I take over the presentation. She's obviously having network.
Yes,
problem.
ma, we can
Yes, ma'am, we
hear
can
you.
hear you. We can hear you, ma'am.
So vaccination against HPV should be incorporated in the National Program of Immunization Schedule. Continue. Next slide. Next slide, please. States should be supported to establish cancer registries, and the 5-year survival rate of cancer patients should be used as an indicator for tracking progress in cancer control. There should be continuous.
Can you hear me?
Dr. Okwe, let me just finish up because of your network so that we can wrap up. There should be continuous and sustained advocacy for all states to have functional health insurance scheme. No state should be left behind. National and state insurance schemes should incorporate at least partial coverage for cancer treatment. There should be legislation and initiatives that will make health insurance mandatory, and individual corporate responsibility where the rich pay health insurance premiums for the poor should be promoted, and efforts to raise funds for treatment of cancer patients should be supported. Next slide. So as we're about to embark on the project, we had to do a need assessment of resources. And one of the resources we felt was the health insurance scheme. Even if they did not have cancer screening and cancer treatment, let them have the health insurance scheme. And that will enable us to at least start the advocacy on incorporating cancer treatment. And we found out that out of our 36 states and FCT, only 16 had some form of health insurance. Next slide. So for us, when we started, we had to request for our states to send the account numbers, because we found out that to make the pap smear flyer, which they are going to use to distribute in the antenatal clinic, in the immunization clinics, it was going to be difficult to courier them to the states. So what we did was to send money. We sent them the electronic copy and we asked for their accounts, and then we sent the pap smear flyers, and then we sent the soft copy of the pap smear flyers, and then we also paid money into their accounts. So far we have paid money into 19 accounts. Meanwhile, we have 33 inaugurated state branches. So the question is, what is happening to the remaining 14? That is the challenge. The remaining 14 branches of MWAN, because they did not give us account number, we have not been able to send to them. Now, the results of the next slide of the worthy shows that we have raised from our fundraising 1.724 million, and we've expended 300,000 to support treatment of 2 cases of breast cancer and 1 case of cervical cancer. We have already got a video testimonial from the case of cervical cancer, which I shared with 4 members of the National Assembly this morning as part of our advocacy for HPV, as well as for incorporation or expanding the coverage of cancer treatment in national and state health insurance schemes. 380 has been used for production of cervical screening flyers for 19 states, 150 for production of cervical screening flyers for 10,000 PHC. So we actually went to the OCA NMA NEC meeting, and there we were able to meet people who will be willing to take the flyers for the primary health centers in different states. So we have distributed to several states. There are still a few that we couldn't find anybody. So we are probably going to look for another opportunity, because the cost of sending by courier would have been very difficult. And we are very appreciative of Dr. Batulu, who gave us the list of the numbers of all the primary health centers in each of the states to guide us in the distribution of those flyers. So the idea is that at least the health workers in the primary health centers, they will see what cervical screening is all about. Some of them don't even know what cancer of the cervix is. So if they see a patient with those symptoms, they won't even have any idea. So at least each primary health center in Nigeria, 10,000 in all, will be able to get a flyer that will give them awareness with our phone numbers and our contacts, so that they can ask questions and they can be guided. And then we have spent 96,500 to support cervical screening for 198 women. Now we have more of our medical MWAN state branches that have done cervical screening, and we have been asking them about 3 states, right? Because you cannot get money from the National Secretariat if you don't write an application. And the application is an email application, because when we are going to have auditors to audit our accounts, we are going to print out all the emails of our approvals and send. So if there's no approval, you can't get the money. So I don't understand. There are some states that I have reminded up to twice about giving us their, writing their application, and they have not yet done that. So I just want us to understand the challenge of implementing a program. It looks so beautiful, saying 6,000. It looks so great, raising fund. But now we have the fund and we are begging people, just write an email and you will get your money. That is the challenge. So I hope Dr. Azodo understands that challenge, and you will be able to counsel us on how the Federal Ministry of Health deals with such challenges. So we now go on to monitoring and evaluation of health programs. During the presentation of my inaugural speech as National President on the 14th of September 2019, I outlined a number of indicators to monitor and evaluate our activities throughout the biennium. First were the indicators for our theme and sub-themes. Our theme happened to be male involvement in maternal and child health, and the indicator was number of male champions we've decorated. So we have decorated up to 11 male champions, and the 11th is Professor Innocent Uja, MNI, President of the Nigerian Medical Association, who was decorated on Friday, 11th November 2020 at the NMA NEC meeting in Oka. Now, what did he do to qualify? We say if any man would give us an audience with men in a gathering where we can come and talk to them about male involvement in maternal and child health. And we have our 10-point agenda. We have our flyers, and we need minimum of 15 minutes. We asked the previous NMA president, and he said he can't give us 15 minutes to talk about that. So he didn't become our male champion. But maybe because Professor Uja is a gynecologist, he gave us, after a lot of pleading, and he gave us that opportunity to talk to about 200 men. We just needed 50, but there were 200 men there. They were all doctors, male doctors, and we sensitized them. The issue now is we have been talking to ourselves, MWAN, for a long time. At our biennial conference, we don't even have 1% of men coming. Will we talk and talk and talk and talk and talk? I hope everybody is hearing me. I'm not talking to myself. Can you say yes if you are hearing me?
Yes,
Fine.
ma.
Will we
Yes,
talk and talk and talk?
Yes, my president.
Yes,
Yes,
ma'am. Yes, ma'am. We can hear you. Yes, ma'am.
Okay, thank you. And we will go back. Then we'll come back 2 years again, talk and talk and talk and talk and talk. So we said, no, the people who are going to make a change, they're the men. And they don't come for our meetings. They don't come for our biennial conference. They don't come for our programs. When I was being inaugurated, my male colleagues, permanent secretaries, many of them did not come. Instead, they sent either their wives or their female staff to come and represent them. So anytime they hear women affairs, oh, they say no. And so we've been talking, and the problems are not changing. So this time we go out and talk to them. And when Professor Uja gave us that opportunity to address about 200 male medical doctors, we had to make him our 11th champion. Now, going on to the next slide. Our target has been 1 president, 6 governors, 12 NAS members, 72 members of the House of Assembly, 6 traditional rulers, 12 religious leaders, 5 proprietors. Now, out of the 11 people, only 2 fell into that group. We've decorated 1 president when he gave us media publicity, great publicity, media coverage by honoring our international president and granting her a special reception in Aso Rock. And so at that point, we decorated him. And we also decorated 1 governor of Akwa Ibom State, Mr. Udom, for passing the VAP. So more people are expected. Our state governor, Delta State governor, we expect to decorate him, but we are yet to get audience with him. So monitoring and evaluation of health systems, health programs, sub-themes. We have maternal and neonatal tetanus elimination. So we use the indicator of before and average and after coverage of TD1 to TD5. That has been tricky because we found out that sometimes the people who are giving us the data, they give us for all the TDs. So if somebody takes TD1, maybe 10 people do TD1, they'll put 10. Then 5 people do TD2, they'll put 5. And then maybe 1 person does TD5. So they will now give us in 1 month 16. So we don't know whether it is TD1 or TD5 or all of them. So that's why we have to do in-depth analysis. And the result we got from River State was very helpful. We will use their pattern to do the in-depth analysis. So now we are looking at how many, and the coverage from what we have seen is still not what we expect. That can be seen from the table that Dr. Agonle presented. Now, the other sub-theme, elimination of harmful traditional practices, especially female genital mutilation. The indicator is number of cases of female genital mutilation reported before we started our campaigns and after. And then also number of widows empowered who have previously experienced harmful widowhood practices. So initially we had 7 cases of female genital mutilation reported by members of the association in February 2020. Thereafter, we circulated this message. Are you a female doctor in Nigeria? Have you attended to a female patient who has experienced genital mutilation, old or new case? Please document how many cases you have seen monthly, beginning from 6th February, and send them to the persons below on the 6th of every month, stating your name and the state in which you saw them. And you have my name and Dr. Agu. Sorry, she was Dr. Agu then, she's now Professor Agu. Please circulate widely on state platforms. I do not know how many states circulated it, but since that time, and we have circulated it several times, only 1 case of an infant who underwent female genital mutilation in Delta State was reported. As for the widows, we have empowered widows through our state branches in Adamawa State and in Anambra State, but we have not identified those who experienced harmful traditional practice. Then for economic empowerment of women for health and economic empowerment of women in health, in that case, medical women in business, we wanted to know the number of medical women in business who support MWAN programs. And if you recall in the introduction, I said out of 17 people that supported our campaign for president-elect and hosting of national secretariat, only 4 were women. The remaining 13 were men. So I'm pleased to say now that medical women have supported MWAN programs, but we're yet to determine how many of them are in business. 13 medical women contributed to the Italian Medical Women Appeal. 62 NEC members contributed to the pause for our late NEC member, Professor Fumi Francis Ajose. 42 out of our 43 pink donors who donated funds for our cancer project are medical women. 23 of 24 persons who bought pink donor promotional items in support of our cancer project are also medical women. The number of medical women in leadership positions who support MWAN programs. We have 2 medical women in leadership positions who have contributed 50,000 each to the organization of the MWIA Near Eastern African Regional Congress. I think we can give our medical women a big hand. So for the issue of overcoming intimate partner violence, we wanted to know the number of sensitization programs to relevant stakeholders. We have organized at least 4 programs to sensitize men on male involvement in maternal and child health, and that includes intimate partner violence. We also have 2 cases of intimate partner violence out of the 14 cases of violence against women and girls reported to the National Secretariat, but we have not conducted research to identify the determinants of intimate partner violence. So general indicators, the number of MWAN adopted facilities showing improvements in family planning through massive sensitization. So those states like Delta, that the family planning is very low, we're now going to do massive sensitization, and we're hoping that after that, the data will improve. Coverage of TD1 to TD5, this can be seen from that table. We know that Zamfara has a very large number of neonatal tetanus, 12. When I saw it, I screamed. It should be a headline. So we're going to do training on the use of chlorhexidine, hygiene practices and all that. We've already sent them flyers on maternal neonatal tetanus. We will mobilize women of childbearing age to go and get vaccinated. So all that, Zamfara is now our focus for maternal and neonatal tetanus elimination. And the issue is when we talk about it to some stakeholders, they say, is it really a problem? And we say, we want Nigeria to no longer be among those countries that have not eliminated MNTE. Why? If you look at the countries that have eliminated, we are better than them. The only issue is that we did not give it a priority. We did not monitor. We did not evaluate. So with this now, we hope that stakeholders will take us seriously. Exclusive breastfeeding and other infants and young feeding practices, we can get that from the table. Then the number of reports on monitoring and evaluation of MWAN activities. This is the first dissemination activity on monitoring and evaluation, and we are going to be doing it every month till September when we are handing over, but we will not dwell on the same thing each time. We may just summarize to give us updates and we'll dwell on other things because there's so much data that we can use. Then for the general indicators, we have number of governments implementing free maternal and under 5 healthcare. We've not actually asked our states to do that. So after now, we're going to do that. So it's yet to be determined. Number of states conducting regular maternal and neonatal death audits. I know that Delta State is doing that, but I do not know of other states. So other states have to give us information on that because that maternal and neonatal death audit is so important for maternal mortality to be eliminated in this country. If you see the reasons, we participated in the maternal death audit in Central Hospital, Whaley, because I'm a member of the MPDSR steering committee. And we said we must go out. We have to get them to do the reviews. They were submitting data and the data they were not reviewing. There were some that were not submitting data. We had to write to HMB to query them. They started submitting data. Then we said, okay, why are they dying? Do the reviews. The ministry released money, they did the review. So we went to sit with them. And if I tell you why some women die, you'll be sorry for this country. I don't want to cry again like I cried the last time when I was talking about maternal mortality. So let me just go on. Number of states implementing a blood transfusion service that is based on voluntary remunerated blood donation is yet to be determined. But we did World Blood Donor Celebration in June last year, and Delta State and Kaduna State participated. Number of states that organize regular training on basic life support, neonatal resuscitation, routine immunization, social mobilization, and health data management. So when we did not have COVID and we're planning, we thought we were going to get states to do this. But with COVID, we've started with basic life support in Asaba and neonatal resuscitation, but we were not able to, that's before COVID, we were not able to get enough participants. But as God will have it, when we all learned how to use Zoom, we did routine immunization, social mobilization, and health data management. So we've been able to train medical women in these areas, and they're supposed to use these skills, not only for the adopted health facilities, but wherever they are working to improve data management and social mobilization. So please, these are areas, Madam Director, we will want to partner with the Ministry of Health in capacity building at the grassroots level. Then for the SDG indicators, this one, we got it from the NDHS 2018. And so this is nationwide, no longer just M1. Maternal mortality ratio is 512 per 100,000 live births. We're not going to get another ratio through NDHS until 2023 because it is every 5 years. So what will happen now is that every health facility has to calculate their maternal mortality ratio. We are doing that for our adopted facilities, but we are going to continue to advocate. All the teaching hospitals must know their maternal mortality ratio, how many maternal deaths and how many live births. You calculate and see, are you above 512 or are you below 512? Neonatal mortality, it is 39 per 100 by 1,000 live births. Deaths and injuries from road traffic accidents is not available in the NDHS. Contraceptive prevalence rate for currently married women is 70%. The 2018 NDHS said they are targeting 27. That is too poor. So for us to calculate our contraceptive prevalence rate, we must know our women of childbearing age and know those that are using modern contraceptives. Universal coverage for maternal and child health services. Our needs assessment revealed only 16 states that have some form of state health insurance. So we have to do advocacy to 20 more states. Then goal 5, access to sexual and reproductive health and reproductive rights. Those people who are accessing family planning services with the flyers that we are creating awareness on what is available. Those are the things that we are doing. So I want to, at this juncture, call upon all those who are at this program. Right now, we have 93 people who I believe are hearing my voice. And I'm pleading, I'm making a passionate appeal. Nigeria is not going to change in our generation if we continue to call Buhari and our various state governments. We have to join the change, train, and recruit others. That is known as citizens' participation. Bring out the president, the governor, and legislator in you. Make change begin with you. Set a goal for your office and home to be achieved in the next 6 months. Develop indicators to determine how to monitor and achieve that goal. Work hard to accomplish that goal. Share success story with someone and recruit them into the change train. Set another goal to be achieved. That is the way forward for our nation. When I looked at all that we put as indicators, I knew it was going to be very, very hard to continue and monitor. You can imagine you begging states to just give your account number to pay money, and they are not even answering you. They will say they didn't see the message on the WhatsApp platform and so on and so forth. But we continue to try, and we are presenting it so that everybody will know that whatever you are doing in your place of work, even if you are a house officer, you can keep record. As a house officer, all the patients I saw, I had a record for them. The book is still there. I can look at it over 30 years and say this was what I did during my housemanship. So there is no need for you to wait until you are director or permanent secretary or CMD or provost to make sure that you show that you are a leader. Once you become a medical doctor, you answer that name, DR, and it is medical doctor, MBBS or MBBCH. Please, you are a leader, and you must show that you can implement, monitor, and evaluate programs. In conclusion, in order to improve the health indices of African nations like Nigeria, we must institute an efficient monitoring and evaluation system that involves all players in the health sector using objectively verifiable indicators. Secondly, we must identify health workers who are doing well and motivate them financially and otherwise. Right now, I want to believe that in spite of the economic crunch, there's a lot of money floating around. We're no longer traveling to Abuja for all kinds of training and meetings. Everything is so virtual now. All that money that has been saved can be used to motivate and incentivize health workers. Give them a target. Tell them that those who can get BCG vaccination to 90%, which can be verified, not the one you just go and write fictitious figures. Anybody that does that, fine, you are going to get 100,000 at the end of the year. You will see that they will do it. SOML started with that incentivization of health workers, but the bottlenecks were so many that after some time, some just gave up and everybody just go and collect the general. But those who started at the beginning, I remember states that had up to $7 million as their incentive for improving their health indices. Even though the SOML may be wrapping up, we should institutionalize incentivization in every program, and we should monitor and evaluate. Thirdly, we must identify health workers who persist in doing badly and sanction them appropriately. The sanction may just be a rebuke. What I used to do for my family planning providers when they come for technical advisory meeting, I tell them, why did you not do this? They will give all their reasons. I will now ask their mates, why did you do this? They will tell us why they do. I'll say, yeah, go and do likewise. Then those who refuse to bring their data or show interest, we boo them. We say, shame. And those who do excellently well, we clap for them. Sometimes I even say, oh, your report is so beautiful. Take 1,000. Do you know that they will even write it in the minutes that one of them had a beautiful report and was given 1,000 by the director? That little way of appreciating is an incentive that will make our health workers do well. And when you scold them for not doing well, and you can only scold them if you're monitoring. If you're not looking at the data, how would you know whether they are doing well or not? It will make a change that will solve Africa's problem. Finishing strong. The virtual meeting on monitoring and evaluation of health programs will be held every second Saturday of the month at 12 September this year. So please save the dates. Through this exercise, the National Secretariat of the 2019 to 2021 M1 Biennium, domiciled in Asaba Delta State, hopes to finish strong by September 2021 when we hand over the baton to M1 Oyo State. Thank you, ladies and gentlemen.
Thank you, Ma.
Thank you, Ma.
We are going to take Dr. Vivian Omo Agoja's presentation on Oriflame, product marketing, the Oriflame experience. Can we have a presentation before we take general questions? Okay,
Dr. Stanley Opai, yes,
is here. Thank you. Dr. Stanley, you're very welcome. Please, can he give us his goodwill message?
Okay.
Thank you very much, and good day, everybody. I'm happy to be here. I'm again Dr. Stanley Ubai, Project Director for the Partnership for Advocacy in Child and Family Health, also known as PASS. In the past, we have been partners with Medical Women's Association for Nigeria, in the area of routine immunization. And so far, it's been a very blissful partnership. The Partnership for Advocacy in Child and Family Health projects an advocacy project that aims to, increase fulfillment of the Nigerian government's commitment to child and family health in Nigeria. The project also aims to increase the capacity of indigenous civil society organizations to work in collaboration with this outcome. And this is something that we're very passionate about. So to be invited to a meeting where monitoring and evaluation is being done is something that gladdens my heart. For us at the PASS project, M&E aims to monitor processes, outputs, and outcomes.
Oh my God. Let's give him 1 minute to come back. So sorry. Network, it can embarrass people.
And Dr. Omar Agoja starts sharing her slides now, ma'am.
Yes, let us start. Whenever he comes, he will finish.
When he comes back, we can finish.
Okay, all right. Thank you very much. Okay.
Can you still hear me?
Thank you. Okay.
Okay, please go
so
ahead.
Let me
Even though
pause.
that
Let
slide
me
is still
pause.
showing. Yes,
I'll pause.
Go
Okay.
ahead. Thank you. All right. We are hearing you, sir.
Oh, thank you again. Sorry, my network has been fluctuating all day. I apologize for that. Let me just end by saying we look to continue partnering with Medical Women's Association of Nigeria, because wherever women's voices are amplified, there is a lot of change. And this is something we've seen over time. And I'm just taking stock of some of the impact that Dr. Oseje has just reeled out. It shows that a lot of partnership needs to come in your way to improve and increase the already profound impact you're making in Nigeria. Thank you again to MWAN for agreeing to partner with the Partnership for Advocacy in Child and Family Health at scale. Thank you very much.
Yes, and I forgot to mention when I was talking about your support for our adopted health facilities that you are supporting Kano State, and they have been giving us reports of the activities. We want to appreciate you for that. Thank you so much.
Thank you very much, ma'am. Thank you for your partnership.
All right, so we'll now have, okay. Somebody just sent me a correction that Dr. Uja was decorated on the 11th of December, not on the 11th of November. So I'll make that correction. Thank you. So please, can Dr. Omar Agoja share her slide and let us listen
Thank
to...
you very much, Madam President.
Yes.
Good afternoon, all.
Good afternoon, ma'am.
Happy New Year once again to everybody. This is like our first meeting for this year, and it's really nice to see spaces. Although most people's screens are not on, so we're just seeing names. But Madam President, I really want to appreciate you for giving me this opportunity to be in today's meeting and to present what I do with Oriflame. I don't know if I'm being heard.
Yes, you are being heard very well.
Okay. Thank you very much.
We hear you very well.
Yeah. So by way of introduction, I'm Dr. Eewh M E, a consultant rural maxillofacial surgeon with Central Hospital Saple and the National Publicity Secretary. I'll be talking about my network marketing. This outline, basically, I'll tell you a brief about me, story about what Oriflame is about, the benefits of joining Oriflame, and how you can get started if you're interested. Then in conclusion, basically, I am one of those that you say was never an entrepreneur. I was a medical practitioner to the core and a mother because I started residency with 2 children, had another child doing residency, then my 4th child immediately after residency. So I was like fully into taking care of the family, minding my business, my medical practice and all that. But sometime in 2018, I needed some cosmetic products, okay? And we all know that basically our salary as a doctor, you say that your salary is basically enough for you, you are earning well, so you have this false sense of security. You don't want to move out of your comfort zone. But I now had a challenge, a very big challenge. I needed safe products, especially cosmetics. I'd been to the UK before then, and I was using MAC Cosmetics, okay? But my cosmetics got finished and I needed a refill, and I couldn't get any reliable source to use. And I got introduced to Oriflame. So that was basically how I got into Oriflame. And I started using their products and it was beautiful. The comments I was having from the products was out of way more than what I had, even when I was using very expensive brands. So that was actually how I got introduced into it. Then, being a consultant, I registered and I was getting directly from the company as a consultant with Oriflame. Once you're a consultant, you get registered in my own team. I can speak for that. You are introduced in a WhatsApp group. I now discovered that people were making a lot of money from selling the products. And that actually got me interested. And I kept asking myself, if people can do it, people can make X, Y, Z in a month, why can't I? Why should I just be there counting numbers and just using the products for myself? So that was actually, that was when I decided to, okay, let me go the extra mile and start doing it as a business. And of course, the extra income that has been coming has really been very helpful, and actually got exposed to a lot. Normally, I'm just like into myself, but now I have a team that I have to build, a team that I have to grow. I now discover that I can actually give life to a lot of people. Those that don't have any form of income, you can get them in, show them the way, and it's actually been awesome. So basically, that is my story of how I got into Oriflame and why I've been there till now. Then essentially, what is Oriflame? It's a Swedish-based company dealing cosmetics. We all know that. And it's not a new company. It's a company that has been on for well over 50 years. Okay. In Nigeria, it was 6 years last year, it got introduced into Nigeria. And it's a direct selling company, which means that you will not see the posters of Oriflame on billboards. You will not see them doing adverts on TV or media. No. It's a company that prides itself with selling directly to our consumers, okay? And it's also a network company. So network as per, you come in, you can get in more people to come and use the products, or you are selling. So it's a network company, and it's one of the top 10 network companies worldwide. So that is the company that I partner with. And basically, what do we do? In Oriflame, you can see the t-shirt I'm wearing. This was an Oriflame t-shirt we made in December when we had to plan an event. We offer you 3 things mainly: to look good, make money, and have fun. Looking good aspect is the aspect that somehow a lot of us know about when you use their products. In all fairness and honesty, the products are good and they're organic based. And our products are so varied. You have products from hair care to facial skincare sets, okay? And we all know that with age, as we age, we age, everybody age every day. Okay, what Oriflame does is we have products that can slow down your aging. Scientifically though, so that how you age, you can determine up to 80% of your aging process, which comes in by what you eat and the things you use on your skin. So that is where we come in. We have a lot of anti-aging products for both men and women. We have cosmetics, very safe products. That's the beautiful thing about all our products. Our products are safe and they're organic based. Okay, our products, we have the hair care, we have skin care, body creams, sunscreens, but what do you call it now? We have foot care for treatment of cracked feet and all that. We have a lot of products. Your day-to-day needs, you can safely get them from a company that you trust. And that was also one of the attractions. This is me looking all well made up from Oriflame products, okay? That's to tell you that our products, you don't really need to look elsewhere. So this is just like a slide showing a few of our products. Like I've said, you can see the makeup, hair care, skincare. Skincare cuts across both female and male, anti-aging skincare sets, beautiful products. And you use them when you can, if you can develop a routine. Really, skincare is something that I preach a lot because I use it. If you can develop a skincare routine, it reduces the amount of makeup that you put on. You can go on for days, you're looking good, you are not having any makeup on at all. Then make money. That's another aspect. As entrepreneurs, as medical doctors, most of us, we get really comfortable with our salary. But the truth of the matter is, no matter how much you earn, our needs are huge. And you have not just your needs, you have extended family needs that you have to cater for. And the saying keeps going that the more you earn, the more responsibilities that you have, okay? So that's having an additional source of income is something that I really encourage people to get. It goes a long way. I know between last year that I actually took my business seriously and now, I know what I've earned from sale of products. Selling our products alone, you get between 23 to 30% profit on each product that you sell. And we know that any business you are doing, if you are getting 25% profit, that is huge, okay? So that is what you get from selling products alone. In December alone, I sold goods well worth over 300,000 naira. Your guess is as good as mine. That extra 100K, what it did to me in December. So that's a very good, from someone that has always been a salary to salary person. Now you keep getting alerts as on the go, okay? Then that's one way that you can earn. Another way that you earn is by bringing in people. We call it what you get your bonus points at the end of the month, okay? And we have a compensation plan system. Your bonuses are accumulated for the month. At the end of the month, you are paid for that month, okay? Then there's also what we call the cash awards, okay? The cash awards come when you achieve some milestone levels. Like what I'm pushing for now is my director level, which is the smallest, the most basic, okay? And that comes to, once you get to a director, you get a cash of 250,000 naira. And mind you, whatever cash award you are getting is in addition to what you get at the end of the month. At the end of the month, there are people that are making millions. People have quitted their routine jobs for Oriflame and they are doing it very well. Okay, so you have those cash awards at the end of when you achieve milestone events like that, ranging from 250,000 naira to as much as 3.6 million. This slide is showing just a few of the alerts that I personally have gotten from Oriflame from when I started. If we look at the first alert was the one I got in June. That was for my May. What I did in May was just about 50-something thousand naira. In June, I made what we call senior manager level, and my income almost more than tripled for that month. So that goes to tell you that every month your earning is not a fixed earning, okay? Each month you decide what you want to earn, you work towards it. At the end of the month you get it. Then this is another slide showing my madams. My madam just got about 12 million, one person in December. That was by achieving what we call diamond executive. She made executive in December, and she got a cash award of 3.6 million because there's a program ongoing, what we call double the wheel, okay? Another 3.6 million. Then what do you call it? Additional 5 million naira for maintaining a car that she had gotten from Oriflame. That goes to show you that with Oriflame, whatever you aspire to be, you can get there. The sky is just your starting point when it comes to your earning. Then there's also CAR awards for consultants, for our consultants, which goes to show how committed the company is to making us comfortable, and incentives. Then having fun is a lot of people that like that's we all as women, we know whenever we travel, we know most times we put everything aside to travel. Oriflame is one company that you join, you work, they take care of you. Okay. Each year we have about 3 local international trips, and all those you have qualification criteria for them. Once you meet those qualifications, you are going for those trips. And the trips we are talking about is not us going, struggling to stay in 3-star hotels, struggling our money. No, they give you what we call the 5-star treatment, and with lots of recognitions. Okay, so it's something that someone, you are looking for that extra thing that you want to do. It's something that will really, really spice up your life and give you something like a new list. Some of our pictures at some of our mainly local events, because last year we didn't have any international trip because of the COVID-19 pandemic. Then Oriflame is a company in Nigeria now. It's just 6 years in Nigeria, but we already have like the number 4 in Africa. We're like the 4th leading Oriflame company in Africa now, okay? And we have a team that is committed to training as you join. You don't necessarily have to come in for business. I joined primarily for the products, but from joining as products, I decided to build something as an additional source of income, which has really been working. And I was able to do that because we have a team that is committed to training. Okay, we have a team that on daily basis, there are training guidelines that you are giving. All you need to do is to follow that template. You bring in, you do that, you replicate, okay, by bringing in and showing them, those that you are bringing in, how to grow. And that is how you grow in the business. This year, we're committed, my team and I, we're committed to making a minimum of 100 persons to start earning in 6 figures, like those of us already earning in 6 figures do. And we know that is no small feat. So because of that, we are really committed this year to a lot of training of our downlines and of downlines. Those that join us this year, we are committed more this year to training and making sure that much more people start earning in 6 figures than before. So why Oriflame? You want to ask, there are a lot of marketing companies out there. I've explained the benefits that you can get from joining Oriflame. You are sure of the good products that you are getting, organic-based products that have been tested over time. Okay, you are making extra money. And while doing all that, you're also getting extra fun. Then in addition to that, we have benefits of getting a lot of gimmicks from the company. These, what you're seeing there, are part of my own take from Oriflame. As we speak now, I've gotten like 7 free bags from Oriflame from someone that didn't take the business seriously, okay? To about 5 wristwatches. Yes, 1, 2, 3, 4 plus the current one. 5 wristwatches from Oriflame, all for free. Bags, then products also. From each month, they come up with different incentives. The incentives could be products or it could be accessories, as you can see. If you want to start an Oriflame business, it's very simple. It's an online business. Everything is done online. Registration and placing of orders are usually done online. All you need is to get registered under a consultant and you are good to go. And I can assure you, really, you will not regret it. Thank you very much for the time.
Thank you so much, Dr. Omoagoja. It's so exciting. I know you mentioned it to me some time ago and it was sounding so vague, but now it is very clear. So I may become one of your students in the near future.
Thank you. Thank you very much.
All right. So we will hand over to Dr. Evo. I don't know if she's still there. Evo, are you still here? Or you've gone? Because you said you will leave by 1:30. All right.
Yes, ma'am,
so,
I am.
I want to know if we have any. Oh, okay. Can you handle the question and answer session, and then after that you can play the inter-trade jingle if it is possible. Thank you.
Okay, ma.
Some questions have been asked on the platform. Maybe we'll start with those ones if you can see them.
Yes, that's what that's where I am now. That's what I'm trying to get. Somebody asked Dr. Choma Jata what kind of skills do they need for the business, for the event planning business.
Dr. Jato, is she unmuted?
No, she can unmute herself.
Okay.
Dr. Jatoma, is she still here?
Okay, go ahead. Ask other questions.
Okay, the next question was to Dr. Lawson. How was she able to combine? Question was from you to Dr. Lawson. How many years on the average would it take to break even in private practice? Is Dr. Lawson still here? Then the next question was, how was she able to combine her research interests despite being in the private practice, considering the fact that most of the research activities are centered in tertiary institutions? Dr. Lawson, are you still here?
I'm here. Can you hear me?
Great. Yes, ma'am, we can hear you.
Sorry, there's a background yeah. How long it will take to break through? For me to say that, it depends on what you mean by that. I mean, if it's how long it will take to establish your practice, and it's usually within a year, you should be well established to go about it the right way. Initially, you may not have much profit, but definitely with time, the profit will come in if you do it right and by the grace of God. So it's difficult to say how long it will take to make the breakthrough. Concerning the second question, research is an area that I enjoy and I continue to do. I will still go back to my late husband because he actually put me back on it. In Jos, I was more into research study, and when I got here, I couldn't continue with that. But he started the TB research lab in Zankli and had the first backtech machine for the culture of TB, and he was very much involved in that. We also had the first backtech blood culture machine there, and with that, he was able to attract other people from different organizations, mainly out of the country initially. So we had collaborations with universities in Nebraska, Liverpool, in France, you know. So a few of them because of the work he was doing. And from that, it opened up the hospital as a hospital that does research. So we continued, we had infectious disease programs, grants, and then from there, my own sickle cell research picked up very well. If you are known for transparency and honesty, the international organizations will always look for you. So from what he had done and the follow-up with the infectious disease projects and studies that were done, sickle cell also came on it. In fact, the first HPLC machine for the screening of newborns for sickle cell disease was in our hospital, and we screened over 10,000 children in Abuja and Kaduna in the year 2009. So there is no limit to what you can do in private practice if you are transparent and people see that you are interested in doing this research and you are keen about it. Even within Nigeria, we work with even the University Teaching Hospital. We said that the sickle cell research center for I've forgotten, Center for Research for Sickle Cell. I work with them and some other organizations within Nigeria too. So if you have an interest and you show that you are committed, you can still do research in private practice and write your papers.
Thank you so much, ma'am.
Please, what are the first question before this last one she answered about staff management? They have 200 staffs and they're managing them very well. Can she please give us tips towards towards staff management, please?
Okay.
Or human management?
Yes, we have an organizational where you have the chairman of the head, and then below that you have the CNG, you have the director of clinical services, then you have the director of admin, and then you have the director of finance. So, and under them, the various departments. So there's a structure in place. So I may not directly deal with them, but they report to me. And every quarter we have meetings with the various departments and look at their issues and all. And what we try to do, not to overwhelm ourselves, we've actually given out certain parts of the hospital to others to manage. Like we have the people doing security are not under me. I'm not including them in my staff. Those are different. Then those doing the cleaning, we have the critical cleaning services. And we have a facilities manager. So everybody is like compartmentalized, but everything comes together. So the management team consists of the CNG, the director of admin and finance, the chief accountant. So they report to me. So they have meetings, and then I meet with them when necessary. So we actually work together as one, but everybody is under a compartment. It's not easy dealing with people because everybody with their own and all their expectations. But I think just letting them know that they are part of the family has made a difference. They would always say, our staff would always say, we are part of the Zanti family. So even their own personal challenges, they come to me. And I think that's basically, it's not easy at all, but it's okay.
Thank you very much, ma, Dr. Lawson.
Thank you, ma.
So Dr. Choma Jato has answered most of our questions already on the chat group. We have another question from Dr. Umaimo Morin to you, Madam MP. How's MWAN working towards incorporation of the HPV vaccine into the National Program of Immunization Schedule? What steps have we taken or are we planning to take?
Okay, thank you for that. For now, it is mostly advocacy. If you do recall, some time ago, I talked about two circles. You have the circle of influence and the circle of control. The circle of influence, the circle of concern and the circle of influence. Circle of concern is very wide. You are worried about so many things. You are concerned and all that, but you can't control most of them. Those are the things in your circle of influence. So you can see we have presented things that are in our circle of influence. We picked specific health facilities. We wanted actually one per state, but since the states, some of them could not go through to even select, we have 13 and we may end up getting 2 more. So those are within our circle of influence. We are supporting them through training. We're supporting them with flyers for awareness creation. We're going to support them with consumables and drugs like the chlorhexidine for cord care. And we're also going to get neonatal resuscitation ambu bags for them. So what we are saying now is that is what we can choose. Where does MWAN get? Except MWAN gets funding. And to get funding, you need a long-term relationship. The proposal will come out, call for proposal, then you will write. Then you will wait to hear from them. By the time you are hearing from them and the project is a 2-3 year project, your tenure is over. So it is really a challenge getting that kind of funding. But we can raise funds. We have raised almost 2 million by just calling, and it's mostly our own members. So what we're saying is that all that is within our circle of influence. Now to now say, what can MWAN do for HPV? That one, the money, HPV, the ones for my daughters, it cost 11,000 per dose, and they had 3 doses. That's 33. So we are not talking of 500 for VLI and VIA, 500. We're not talking of 33,000. Where are you going to get that money? How long will it take to raise? So we cannot say we are going to now begin to provide free HPV screen as part of MWAN in this biennium, but we can do advocacy, and we have started. I am very happy you, Dr. Memu, yourself, you were the one who represented me at that meeting, and we told the Honorable Minister and all the stakeholders that HPV should be incorporated. So we have started. Now, many of us attended a meeting on the COVID-19 vaccine by National Primary Health Agency, and they said one of their major challenges is that they want to introduce Rota and HPV. My heart skipped a bit. I said, wow, that means the advocacy is working, whether it's our own or the one before us. So they have finally heard. So that means they're going to get it done. So it's in the pipeline. The question now is, we want it to be done this year. We don't want it to be like the one you will hear about in 2017 and 2021. It has not materialized. So this morning, the four members of the National Assembly whose contacts I have, I mentioned to them about incorporating some treatment of cancer in the insurance schemes at national and state level, and making sure that HPV is included in the routine immunization schedule this year. I want to see it before I hand over to MP Dr. Tolori. So I've given them a timeline. So I'm making my advocacy more aggressive. And then I sent them the video clip that we got, the testimonial from Akwa Ibom State, the woman that we supported for cancer treatment, that told us that she bled 4 pints of blood. Can you imagine a woman bleeding? She called it 4 gallons of blood is what came out of her woman body, according to her. So I sent that clip to the 4 of them. So they will watch it and they will begin to think. And I also told them that HPV will prevent this from happening. So that's the only thing I can do. If you know what else I can do, please let me know what I can do within my circle of influence. Thank you.
Thank you, ma. The next question is a comment.
Great.
The next question is a comment from Dr. Isha Klawal, who says that we should think about integration of cervical cancer screening into family planning services, as that would represent a low-hanging fruit to accelerate the elimination of cervical cancer in Nigeria.
Yes, so we've been advocating for that. We were the ones that mentioned it at that International Cancer Week held in Abuja. We have done something like that. We started or made an attempt in Delta State, but that was when I was director. When I left, it became very difficult to control because I had so many things and I couldn't micromanage. So we are still talking to partners who support family planning that they should also just add cervical screening. It will go a long way. And let's hope that they will hear. But the other good thing is that there are many medical women in leadership here and also maybe in our states, even though they are not here. We can advocate to them. If a medical woman is the permanent secretary, Ministry of Health, you do advocacy in your state. If she's the director of public health, you do advocacy. Or she's the executive director of the state primary health development agency. So our medical women in leadership can help us push this. The issue why we don't do this is that many of us are already exhausted with so many programs, and then we cannot make a case, a bankable case that will lead to release of funds. You can't use your salary to do all these programs. So it takes passion, it takes patience, it also takes skill. You have to know when to write the memo and so on. I recollect that last year I had to go for a family planning meeting, and I asked, they were just giving excuses why they can't do certain things. And I said, this is the amount of money in the vote for family planning. Have you written any memo? No. I said, I want your memo in the next 1 week. After that, I sent a text message and they finally wrote the memo. The other problem is they've written the memo. What about the approval? I told them it's going to go through different processes. When it gets to the commissioner, it will go to economic planning, then from economic planning to SSG and so on and all that before you get the approval and so on. I told them you have to be following your file. The file can get missing, it can get stuck, anything can happen. And they kept following the file. It was just about 2 or 3 days ago, they sent me a text that the money has been released. So at least we can say Delta State released money in the 2020 budget for family planning. Many other states, Dr. Stanley told us, did not release. Even at the federal level, they had a lot of challenges. So what we are saying is that you need somebody who is knowledgeable and passionate. And we have medical women there. Some of them are new to the job, so it may take them a while to find their feet. But if we who already are in the system, we have attended all the meetings, we have discussed the agenda, when we see our colleagues getting into leadership positions, we should come out and share ideas with them. Because if they succeed, you know, it doesn't hide, success doesn't hide. You just see it in the NDHS that your state was one of the best, and that one can turn your head. So you will be making your colleague who is in leadership position to succeed if you can share those ideas. For me, it is easier to talk to those in leadership position than to go and meet Buhari or minister. I don't know when we will have an opportunity to see minister again. So let's do the one that's the low-hanging fruits that we can do. I hope that helps.
Thank you, Ma. We have a question from you to Dr. Mwagoja. You're asking if it's product marketing not very time consuming for busy medical doctors. Dr. Mwagoja, Ma.
Yes, I've actually answered it. And what I have, the reply is that it could be, but we know that most of what we do is online. Okay, so your timing is very flexible. It's something that you can do in between schedule, late at night, early in the morning. But the bottom line is how motivated are you in getting those results that you want? Okay, so that actually determines how much effort you are willing to put in to building your network.
Thank you, ma'am. Then lastly, from Dr. Omolara Taiwo, M1 Oyo, she's asking if for those states who have refused to apply for their funds, if it can be channeled to the other states who have applied already.
Yes, we are thinking about that. In fact,
Wow.
we are attracted to the Gombe states that they want to do 1,000. So far, we only have 198 in our record. So if Gombe, we support them with 500,000, who get 500, 5,000. I mean 1,190. We get closer to our target. So the idea was that every state should do 200. The states that have even done 50, 90, 70, they are not even asking for the money. In fact, I don't understand. So, so we plan to do it in 2 phases. For instance, Enugu, they did about almost 200. But because we said we're going to, in the first phase, to make sure that we have spread, you know, the money, the donations, they are not coming like that. And we don't want to carry the whole money and give to one state. So we said we'll do it in 2 installments. So we'll pay for 100 first and all that. But February is cancer month. 4th February is coming. So if those states are not ready, we will go and we'll just pay the second installment and all that. And then states like Gombe that can do 1,000, we will get them. The most important thing is that 6,000 women get screened. We started the project in October. So by March ending, we should be rounding up, or let's say middle of April, because we actually started middle of October. So let's say by the end of April, we should be rounding up. So
Thank
that
you,
is the question. So I've already answered her. Yes, thank you.
Thank you, ma. So a question to Dr. Azodo. I don't know if she's still online with us. Dr. Osiobu from Geriatric Association of Nigeria is asking if there are links to enable us access the details of the different initiatives she mentioned.
Yes, there are. I'm going to post the links. Thank you. There are links.
Great. Thank you very much, ma'am.
Yes, I'll send it so that we can put it on the one platform.
Thank you very much, ma'am. Thank you very much, ma'am. So in all, we've had a very successful section this morning, our first M1 meeting of 2021. Call on Dr. Onyeowa for the closing remarks.
Yes, I'm here.
Okay, so Dr. Owa, go ahead, ma'am. The National Internal Auditor, M1.
Thank you so much, Evo. It has been a wonderful time. I, on behalf of the Medical Women Association and our special guest on the platform, extend a hearty vote of thanks to all speakers for gracing this event and sharing with us their experiences and opinions today. Special thanks to our guest, Honorable Yusuf Tankos Tununu, the House Committee Chairman on Health Services, Dr. Ngozi Azodu, Director of Health Planning and Research, Federal Ministry of Health, Abuja, and Dr. Stanley Ukpai, Acting Project Director, Development Research and Project Center Partnership for Advocacy in Child and Family Health at SCIP. They are good representatives. Nonetheless, we are honored. I must mention a deep sense of appreciation to Dr. Spunke Lawson, a former National Coordinator of Medical Women Association of Nigeria, Dr. Choma Ajatu, former President of MWAN Anambra, and amiable and swagalicious National Publicity Secretary, Dr. Vivian Omo-Agoja, for providing encouragement to participants in having an extra means of income apart from medicine on their expose on various experiences in making economic empowerment possible amongst women in health. We applaud your efforts, Maz. I'm also grateful to Dr. Bobola Abole, our ever calm and collected national coordinator. Same for our National Assistant Secretary, Dr. Uche Okwe, a humble lady who have tried to analyze our health programs coordinated thus far. We showed we have made so much positive impact nationally and pray to improve more in the coming years. We are all inspired now to do more. Finally, I cannot thank everyone enough for the involvement and willingness to take on completion of tasks beyond their comfort zones, especially the technical team, as well as our ever dynamic national YDF coordinator, Dr. Evo. You are awesome. Kudos, Madam MP, Dr. Mini Oseji. As usual, you are awesome, ma. You did it. Dear executives, ladies and gentlemen, once again, I want to state that we are all most grateful. We thank you for being with us this morning till now. It has been a great pleasure. Thank you very much.
Thank you. Thank you. So we'll call on Dr. Otolori, please. Can you close us, our national president-elect? Please give us a closing prayer. And after that, we'll have the advert so that people are not obliged to remain.
In Jesus' name.
Amen.
Heavenly Father, we thank you for bringing us to the beginning of another year. We thank you for making us to overcome 2020. And we are starting off in a good way this year with the innovation of this Zoom meeting with the President. Glory be to your name. Lord, we pray that you map out all our actions for us this year and grant us the zeal, the energy, the wisdom to implement. Also, we pray for all our collaborators, oh Lord. Help them to have the spirit of giving freely and good networking. And we pray that there will be no donor fatigue. All of us will be interested in helping another woman, less privileged women. And we pray for our president. Father, grant her new ideas together with her team and give her a glorious ending. For all the members, we thank you, Lord. And for all our participants, our keynote speakers, we say thank you, Lord, for giving them the wisdom. As we finish this program, the grace to step down and spread the message, let it be our portion. Thank you, Lord, for we pray in Jesus' name. Amen.
Amen. Amen. Thank you. Thank you. Thank you. Bye.
Bye.
Bye. Bye, everyone.
Bye.
Well
Bye.
done. Bye.
Well done, Madam
Bye.
National President and your team. God bless you.
Bye, ma'am.
Bye. You are
Thank you.
not
Oye, how are you?
Hello, ma'am. Fine. Happy New Year, ma'am.
Bye.
Same to you.
God bless you all.
Evo, how far?
Madam MP, good afternoon, ma.
Good afternoon, oh, my sister. How are you?
Madam MP. Fine, thank you, ma.
Thank you. And congrats, Kwara and Kaduna, congratulations.
Are you black?
My president, well done, no. You know,
Thank
go
you.
tire. You know, go tire.
Amen. Amen to
Please,
that.
mother, she know they tire. Oh. We live with the love of mother, so we cannot be tired.
Congratulations, ma'am.
Thank you. My president, Dr. Taiwo, how are you?
I'm fine, ma. Happy New Year, ma.
Happy New Year.
It's lovely as usual.
We love you too. So come and carry me well.
The advert, the advert, is it coming up?
America's Alaska Nigeria.
Everybody sharing the adverts.
Dr. Ogoja.
Yeah, that's not tasting food in Nigeria. That was a different Coca-Cola.
Dr. Evo, give us an update. Is there any hope? Dr. Evo, are you still there? Can you hear us?
I think Evo is she the host now or co-host?
She said she was going to do it. She did not tell us that. She would have sent it to Dr. Owa. I thought we were going to actually start from the beginning. So that's why I didn't bother Dr. Owa. So do you know if she's still online? She's not answering. Maybe
I'm seeing, yes. I'm seeing myself and herself, but I'm not.
Can you send her a text message? Let's know what is happening. We're down to 31. Almost everybody has gone.
Give me my almost.
Hello, ma.
Hello, any love?
I'm trying to do it now, ma. My laptop just went off, so I'm trying to do it.
Okay, thank you so much. Sorry about that.
No problem.
It's how you make me feel every day. You they give me butterflies now.
right now. This is your
You're the only one I want. You give me butterflies. Sometimes I feel like baby out of flight. That's how you make me feel every day. You give me butterflies now, but now it's you, baby.
Prostate. The following public and community health services are available at Baraka Community Clinic, located at 10 Chiagozian Street off DLA Road, Asaba. Outpatient consultation, immunization, growth monitoring and nutrition services, screening for cancer of the breast, cervix, and prostate, free HIV counseling and testing, free screening for diabetes mellitus, reproductive health services, school health services, occupational health services, comprehensive health screening, medical checkup with reports, travel health services, treatment of infectious diseases including STD, home-based care, medical outreach services, telemedicine services, community-based research, training in infection prevention and control, health data management, social mobilization, and healthcare waste management. To book an appointment with us today, do send a text to 0802 301 5944. Again, 0802 301 5944. The medical team at Baraka Community Clinic are your committed partners.
Not really sure, but I want to.
So let's have the intertrade. Doctor, let's have intertrade so that we can wrap up. The others we can leave for another time.
I'm trying to open it. Okay.
Good day, everyone. My name is Engineer Ogedengbe. The name of our organization, which I represent, is Intertrade Limited. We market biomedical equipment. The name of biomedical equipment which we intend to exhibit are vaccines refrigerators. These are vaccines refrigerators are World Health Organization PQS qualified. Under this, we have the Solar Direct Drive SDD refrigerators. They are without or with freezers for ice packs. They are specially designed for small to medium-sized health centers, working straight from solar panels with no batteries and no regulator. What this means is very simple in the sense that you don't have to bother yourself about whether there is electricity supply or not from these so-called power holding organizations. With your solar panel, you can be rest assured that you have electricity supply or power supply, so to speak, to power these vaccines refrigerators. And with this, you can always be rest assured that you have all these vaccines with the same potency at which you have initially stored them inside the freezer. They are always good and they are always there for you to be used any day. The second in this category is ice liner refrigerators. Ice liner refrigerators are used to store all universal immunization program vaccines at the public health centers level. The power supply at each public health center may be unreliable, but an ice liner refrigerator, which is otherwise called ILR, can maintain a temperature from 2 degrees Celsius to 8 degrees Celsius with as little as 8 hours of power supply in 24 hours. If the electricity supply fails, then the ice lining maintains the inside temperature of the refrigerator at a safe level for vaccines. Also, an ice liner refrigerator has a top opening lid which prevents loss of cold air during door opening. Therefore, the temperature is maintained in ice liner refrigerator for much longer duration than in deep freezers, and ice liner refrigerators can keep vaccines safe. The third product that we have for exhibition is what we call pharmacy refrigerators. Basically, pharmacy refrigerators are configured to store pharmaceutical products at a uniform temperature and allow easy retrieval while providing security. Our pharmacy refrigerators provide stable temperature control over various ranges and does have lockable doors and various types of alarms. Our pharmacy refrigerators include an alarm module with robust security features, and other models have a security set point with a key operated triple position master switch. These are a variety of models and sizes available, including undercounted units. Our fourth product is what we call blood bank refrigerators. Our blood bank refrigerator is an essential piece of equipment in the immunohematology department and provides safe and convenient storage of whole blood, the blood components, blood cells, plasma, and reagents. Blood bank refrigerators ensure freshness and integrity of blood and blood components. When you pick or considers our blood bank refrigerators, you can be rest assured that you have an equipment which can ensure storage and a whole blood. With our blood bank refrigerators, you have an equipment to store blood. The system includes an electrical powered compressor, a condenser, a capillary tube or expansion valve, an evaporator, and interconnecting tubing. A thermostat regulates the refrigerator temperature. In many models, the compressor and motor are connected to the same shaft and sealed in a compact, already compartment. They are sealed in a compact, airtight compartment, making more space available for storage. The system of these our products are either cylindrical with rotating shelves or rectangular with pull-out drawers or shelves. A temperature alarm is either included or optional. An emergency power system is necessary in the event of a power failure. Configurations include tabletop or floor units. Our fifth product is solar-powered blood bank refrigerators, and it is otherwise known as sample transportation equipment. The difference between a solar-powered blood bank and that of blood bank refrigerator is that while blood bank refrigerators are connected or are powered by electricity supply from power holding grid, the solar-powered blood bank refrigerators are powered by a solar system. And these fifth products called solar-powered blood banks refrigerators, like I said earlier on, they are otherwise known as sample transportation equipment. The usefulness of a solar-powered blood bank is for the storage of whole blood or red cell packs in a blood bank. This refrigerator uses compression type cycle. The refrigerant is free and electricity is generated from solar energy using solar panels. The cabinet of a solar blood bank refrigerator is insulated with high density PUF 120 mm thick and vacuum insulated panels. The interior chamber is manufactured from finish resistant stainless steel. The exterior cabinet is manufactured using bacteria resistant special aircraft alloy polyester powder coated, and the stainless steel trays are provided for storage inside. The sixth product is what we call constant temperature transportation cooler. These are compact units that will maintain a consistent temperature range between 2 degrees Celsius and 8 degrees Celsius for at least 106 hours. Whatever temperature at which they have been stored in the refrigerators, it will be able to sustain and maintain that same temperature for more than or minimum of 106 hours. And the temperature will range between 2 degrees Celsius and 8 degrees Celsius. These units are ideal for the short-term storage and transport of fresh vaccines. The seventh product is refrigerated vehicles. It can either be trucks, if you need the refrigerated trucks, or you need refrigerated vans. We have both, and these are trucks and vans are meant for transportation of your medical equipment at the same temperature at which you would have wanted them to maintain. You are not only transporting them, you are as well storing them in these refrigerated vehicles. And when they are being stored and being moved around or being transported around with our products, you can be rest assured that the same temperature at which you have conceived and which you would have wanted your products to be are being maintained. The eighth product is what we call mobile clinic biomedical equipment. Here, what this actually meant is the delivery of services by health workers on the move in a variety of transportation modes. It's a tremendous innovation for the extension of healthcare to populations living beyond the reach of static facilities. Our organization does at every time provide mobile clinics. The number 9 product which we have to exhibit is called ultra low temperature ULT freezers for samples. This product is basically used in preserving vaccines, biological tissues, drugs, and special materials, and is an accurate temperature control technology to make the temperature maintain accuracy. This product comes with visual and audible alarm system, high or low temperature, and it has a built-in backup battery to display temperature and to operate audible and visual alarm system for up to 72 hours without any AC power. And its refrigerating system energy, it saves 50%. The 10th product which we have to showcase is solar direct drive walk-in cold room. The 11th product which we have to exhibit is what we call liquid nitrogen containers. These liquid nitrogen containers are used as a cooling medium and is taken from a storage vessel with low pressure, maximum 300 MBAR, and delivered through a fill line to the application in a micro-dosing way. It's a cooling device. So we have this product as many as possible to supply as many health facilities as possible. Your patronage is highly welcome. The 12th product which we have for exhibition, the last but not the least, is what we call safety cabinets. A biological safety cabinet is a primary engineering control which is used to protect personnel against biohazardous or infectious agents, and it is being used to maintain quality control of the material being worked with as it filters both the inflow and exhaust air. It is sometimes referred to as laminar flow or tissue culture hood. These filter cabinets are primarily designed to protect against exposure to particulates or aerosols. You can be rest assured that our safety cabinets are indeed manufactured having in mind the essence of safety itself. Safety to the personnel and safety to all the materials being worked with. In this regard, we seek your patronage on each and every of all our products, even as we have so showcased and displayed all these products to you. Lastly, we thank you most sincerely for your attentiveness and your patience. We hope to receive your patronage on any of our products. For further inquiries and information, you can get in touch with us, Intertrade Limited. We are on 3rd floor, 21, Blantyre Crescent. Our telephone contacts include 080-2335-4833.
Hello.
I repeat,
I am Dr.
02335-4833. Thank you all.
God bless.
National
President. MWAN is a non-political, non-sectarian, non-profit-making organization of qualified and duly registered female medical and dental doctors in Nigeria. Our motto is Matris Animo Curum, which is Latin for healing with the love of a mother. As part of our celebration of Cancer Awareness Month in October 2020, MWAN is launching the Women's Right to Health Information Worthy Project on cervical screening. Our expected outcome is to screen 6,000 women across the nation and treat those that are diagnosed with cervical cancer. We will also provide support for treatment of breast cancer. Hello, I am Dr. Mini Oseji.
I thought you still.
Sectarian, non-profit making organization of qualified and duly registered female medical and dental doctors in Nigeria. Our motto is Matris Animo Curum, which is Latin for healing with the love of a mother. As part of our celebration of Cancer Awareness Month in October 2020, MWAN is launching the Women's Right to Health Information Worthy Project on cervical screening. Our expected outcome is to screen 6,000 women across the nation and treat those that are diagnosed with cervical cancer. We will also provide support for treatment of breast cancer, as well as advocate for incorporation of cancer treatments in national and state health insurance schemes. In cash and equipment to actualize this goal will be very much appreciated. All donated funds can be paid into the following Naira.
Okay, having been done, well, I'm not giving you just a substance. Let me just take you through a particular one where Racing Gang of Belgium striker Cyril Dessers had taken his love for Nigeria to the level where that the country's national team, that's the Super Eagles, will one day play.
Evo, thank you. I think we are done. We can leave the others for another session.
Although for making out the status that Nigeria well, after getting Africa friendly against Tunisia, that was last October. Maybe when it comes to the attack, see that Nigeria can or will play in the quarterfinals. And I want to ask you guys in the studio, proceed. Qatar 2020, the World Cup, FIFA World Cup. Is it possible that the national team, the Super Eagles, 2022, will play or we get to the quarterfinal of that tournament?
Okay, it is still on. I've connected, but it's not going on. Sweetie, I'm connected, but I'm not seeing.
not working. Oh. Even Dr. Smith has left. Thank you, everyone. So we're ending this meeting now. God bless you. Happy New Year again. This is Dr. Evo. Bye.
Thank you, Dr. Evo. Thank you, President. Bye-bye to
MP,
all.
my Dr. Tolori. Bye. Dr.
Thank you.
Odi,
Bye.
Dr. Awal,
Bye, everybody.
Dr.
Thank you.
Koje,
Okay,
Dr.
bye, everyone.
Sandauma, Dr. Nandi, Dr. Yowole, Dr. Henry, Dr.
Thank
Yetunde
you.
Arimu, Dr. Adam, Dr. Wira, and Dr. Uma. Thank you so much. So we're ending the meeting now. Professor Ogo, God bless you. Thank you so much.
Thank you, Dr. Ogu and Professor Ogu. Bye.
Bye, everyone. They should leave. Let me end the meeting.